He slammed into the brick wall from 3 stories up, lungs collapsing, ribs shattering on impact. No one in that overcrowded ER realized the quiet white nurse beside him used to run trauma ops in active war zones. If you want to see how this unfolds, stick around until the very end. Drop a comment with your city so I can see how far this story travels. And if you believe the quietest people sometimes carry the loudest truths, hit that like button right now. The fluorescent lights in Northvale Medical Center's emergency department buzzed like angry insects, casting everything in that particular shade of clinical white that made everyone look half dead. Claire Bennett moved through the chaos with the kind of silence that came from years of making herself invisible. She was 34, pale skin that rarely saw sunlight, dark hair pulled back in a practical bun, scrubs that hung a size too large on her frame. Nothing about her suggested she was anything other than another tired ER nurse grinding through another double shift. "Bennett, grab me a 14-gauge IV kit," Dr. Marcus Holloway barked without looking up from his tablet. He was the kind of physician who treated nurses like furniture that occasionally talked back. Claire retrieved it in under 10 seconds, held it out, waited. He snatched it from her hand, still typing. "And coffee, black. No sugar this time." She didn't respond, just turned and walked toward the break room, her sneakers making no sound on the scuffed linoleum. Behind her, a resident whispered to another, "Does she ever actually say anything?" The other one snorted. Why would she? Holloway doesn't listen anyway. They weren't wrong. In the 6 months Claire had worked at Northvale, she'd learned that speaking up only meant getting talked over. The attendings ignored her suggestions. The residents treated her like a glorified order taker. Even the other nurses had stopped asking her opinion in huddles. She'd become background noise in her own workplace. What they didn't know, what nobody knew, was that Claire had spent 4 years in places where silence kept you alive, and observation meant the difference between saving a soldier or zipping a body bag. She'd run trauma stabilization in forward operating bases where incoming fire was just another thing on the checklist. She'd performed emergency thoracotomies in the back of moving helicopters. She'd held pressure on wounds that would have made most of these doctors vomit. But here, in this clean American hospital with its protocols and hierarchies and egos, she was just the quiet one who did what she was told. She poured Holloway's coffee, black, no sugar, exactly like he'd demanded, and carried it back through the maze of curtained bays. Bay 3 had a suspected appendicitis. Bay 5 was a car accident, minor injuries. Bay 7 was empty, freshly cleaned, the smell of industrial disinfectant still hanging in the air. "Finally," Holloway said when she handed him the cup. He took a sip, grimaced. "Tastes like dirt." "It's the same coffee you drink every shift," Claire said. Her voice was flat, uninflected. "Then maybe get better coffee." He dismissed her with a wave and returned to charting. Claire walked away. She didn't feel anger anymore, hadn't for a long time. Anger was a luxury for people who believed things could change. The shift dragged on. A diabetic crisis in Bay 2. A kid with a broken arm in Bay 4. Standard ER chaos, the kind where everybody was too busy to notice much beyond their own station. Claire floated between assignments, restocking supplies, checking vitals, adjusting IV drips. She was good at being useful without being seen. Around 8 p.m., Dr. Sarah Chen came on shift, replacing the day attending. Chen was better than Holloway. Actually learned nurses' names, said please and thank you, but she still had that look in her eyes when Claire spoke, like she was waiting for Claire to finish so the real conversation could continue. "Quiet night," Chen said, scanning the board. "For now," Claire replied. Chen smiled the way people smile at fortune cookies. "You're always so serious, Bennett. Try to relax a little." Claire didn't point out that in her experience, quiet nights had a way of turning into nightmares without warning. Instead, she nodded and went to restock the crash cart in Bay 8. That's when the radio crackled. "Northvale Medical, this is Rescue 12. We've got a code red trauma inbound. ETA 4 minutes. Male, approximately 26 years old, fell 3 stories from construction scaffolding. Patient is responsive but deteriorating. Suspected spinal injury, internal bleeding, possible tension pneumothorax. GCS is dropping, currently at 11. Vitals are BP 90 over 60 and falling, heart rate 140, respirations 32 and labored." The ER transformed. People moved faster, voices got sharper. Dr. Chen started barking orders. "Get Trauma Bay 1 ready. I want a full setup. Someone page ortho and neurosurg. Holloway, you're with me. Radiology, I need CT standing by. Where's respiratory? On their way, someone called back. Claire didn't run. She walked straight to Trauma Bay 1 and began the setup with mechanical precision. Airway kit, chest tube tray, massive transfusion protocol cooler, spine board, C-collar. She'd done this hundreds of times before, though never in a place this clean. Holloway rushed in, looking more excited than focused. Trauma was his favorite. He liked the drama of it, the way everyone looked to him for answers. Okay, people, let's show them how Northvale does this. Bennett, just keep things organized and stay out of the way. She said nothing, just continued her setup, checking quantities, ensuring instruments were sterile and ready. The ambulance bay doors slammed open. Paramedics rushed through with the gurney between them, the patient strapped down, neck stabilized, oxygen mask over his face. He was young, probably mid-20s, covered in construction dust and blood, his breathing rapid and shallow like a drowning man. Transfer on my count, the lead paramedic said. 1, 2, 3. They shifted him to the trauma table. The patient groaned, a sound full of confusion and pain. His name was etched on the medical bracelet they'd already attached. David Ruiz. Talk to me, Chen demanded, hands already moving, assessing. Found him on the ground next to a building site, the paramedic rattled off. Witnesses say he fell backward off the third-floor scaffold, hit the wall on the way down before landing on concrete. Lost consciousness briefly at scene, but came around during transport. Breath sounds diminished on the right side. We gave him oxygen, started 2 large-bore IVs, pushed fluids. He's been asking for his sister. David's eyes tracked around the room, unfocused, terrified. Can't breathe right. You're okay, David. We've got you. Chen's voice was smooth, practiced. Somebody get me a chest X-ray portable. And where the hell is respiratory? Claire stood near the wall, watching. David's breathing wasn't just rapid. It was asymmetric. His right chest barely moved, jugular veins distending, trachea shifting slightly left. The signs were there, clear as day. Dr. Chen, Claire said, stepping forward. He needs— Not now, Bennett. Holloway, what are you seeing? Holloway leaned over the patient, frowning. Possible rib fractures, definitely. Could be a pneumo, but let's wait for imaging to confirm before we do anything invasive. Claire's jaw tightened. He doesn't have time for imaging. Chen shot her a look. Excuse me? His trachea is deviating. JVD is present. Breath sounds are absent on the right. He has a tension pneumothorax, and if you wait for X-ray, he'll code. Holloway laughed. Actually, laughed. That's a pretty bold diagnosis from someone without a medical degree. We follow protocol here, Bennett. We don't just start cutting people open because we have a feeling. David gasped, his oxygen saturation dropping on the monitor. 89%, 86. He needs a needle decompression now, Claire said, her voice sharper. Then a chest tube. We'll decide that when we see the films, Chen said, though doubt flickered in her eyes. Someone page respiratory again. 82%. Claire watched the monitor, watched David's lips turn dusky, watched his chest heave uselessly. She'd seen this exact scenario play out in a field hospital in Kandahar. Young soldier, collapsed lung from blast overpressure, same textbook presentation. The trauma surgeon had hesitated just like this, wanted to be sure, wanted imaging, wanted confirmation. The soldier died 30 seconds later. Claire moved before she could talk herself out of it. She grabbed the angiocath kit from the crash cart, tore it open, swabbed David's chest at the second intercostal space mid-clavicular line. Bennett, what the hell are you doing? Holloway's voice pitched high. She plunged the needle through skin, through muscle, through pleura. There was resistance, then suddenly, nothing. A rush of air hissed out, decompressing the trapped pressure crushing David's lung. His next breath came easier. Color started returning to his face. The monitor climbed. 85, 88, 91. The room went silent except for the beeping monitors. Chen stared at Claire like she'd just sprouted wings. You can't. She just performed a medical procedure without authorization, Holloway sputtered, his face red. That's assault. That's practicing medicine without a license. I'm calling security. He was dying, Claire said simply. She was already reaching for the chest tube kit. And he still needs definitive management. Security, Holloway was yelling now, backing away from the table. I want her removed from this ER immediately. Two security guards appeared at the door, confused but responding to the summons. Claire ignored them. She prepped the insertion site with betadine, numbed it with lidocaine, made a small incision between David's ribs. Her hands moved with absolute certainty. No tremor, no hesitation. She'd done this in sandstorms and mortar fire. Fluorescent lights and angry doctors weren't going to shake her. The tube slid in. She connected it to suction. More air rushed out, followed by a small amount of blood. David's breathing evened out completely. Oxygen saturation hit 97% and held steady. "Ma'am, you need to come with us." One of the security guards reached for her arm. Claire stepped back from the table, raised her hands. "He's stable now. You should intubate him and get imaging to check for other injuries." "You're done here, Bennett," Holloway said, his voice shaking with rage. "You're fired, effective immediately, and I'm filing a report with the state board. You'll never work in healthcare again." Chen looked torn, caught between protocols and the undeniable fact that Claire had just saved their patient's life. "Marcus, maybe we should—" "She assaulted a patient!" Holloway stabbed a finger toward David. "She performed invasive procedures without physician oversight." "I don't care if it worked. That's not how we do things." Claire met his eyes. For just a moment, she let him see something she usually kept buried, something cold and final that came from watching too many people die because someone followed the rules instead of doing what needed to be done. Holloway looked away first. The security guards escorted her out of Trauma Bay 1, through the ER, past the nurse's station where her former co-workers watched with wide eyes and shocked whispers, down the corridor toward the administrative offices where, presumably, she'd be officially terminated and possibly arrested. Claire walked calmly. She'd known this was coming the moment she grabbed that needle. Some part of her had known it from her first day at Northvale, that this place and these people would never understand what she was, that staying invisible only worked until someone needed saving. They put her in a small conference room, told her to wait. The security guard stood outside, like she might try to escape or perform unauthorized surgery on office furniture. She sat down, looked at her hands. They were steady. Always had been. 20 minutes passed. The door opened. A woman in a suit entered, Joan Pritchard, director of nursing. Behind her came two men Claire had never seen before. They wore civilian clothes, but carried themselves with a rigidity that screamed military. "Ms. Bennett," Pritchard began, "I've been reviewing—" "Lieutenant Bennett." Everyone stopped. The voice came from the taller of the two men. He was mid-40s, graying at the temples, with the kind of posture that came from decades of standing at attention. Claire looked up slowly. Lieutenant Claire Bennett, formerly of the 274th Forward Surgical Team, United States Army Special Operations Command. He pulled out identification, Defense Intelligence Agency. "We've been trying to locate you for 6 months." Pritchard's face went through several interesting colors. What?" The agent, his badge said his name was Vickers, turned to her. Lieutenant Bennett served 4 tours in classified combat zones. She was the senior trauma nurse for special operations units conducting direct action missions in hostile territory. She holds commendations for valor, 3 Bronze Stars, and is certified in advanced trauma life support protocols that most civilian physicians have never even heard of. "But she's just—" Pritchard trailed off, the words dying in her mouth. "Just a nurse?" Vickers smiled, but it wasn't friendly. "Lieutenant Bennett has more combat trauma experience than your entire ER staff combined. She's performed surgery under fire, managed mass casualty events in active war zones, and trained field medics how to keep soldiers alive when evacuation wasn't an option." The second agent stepped forward. "We received an alert when your hospital's security system flagged an incident involving her. We came immediately." Claire finally spoke. "Why?" "Because you're being recalled, Lieutenant. There's a situation overseas. I can't discuss details here, but we need someone with your specific skill set. You've been avoiding our calls." "I've been avoiding everything," Claire said quietly. "We noticed." Vickers pulled a folder from his briefcase, set it on the table. "This is a direct order from SOCOM. You report to Fort Bragg in 72 hours for deployment briefing. Non-negotiable." Claire stared at the folder. She'd left that life behind, or tried to. The noise, the blood, the weight of knowing that every decision meant someone lived or died. She'd thought working in a quiet ER, being ignored, being nobody, would be easier. Turned out invisible wasn't the same as gone. What about the patient? She asked. David Ruiz. Pritchard cleared her throat. He's stable. They took him to CT. You were right about everything. Dr. Chen said if you'd waited even another minute, she swallowed. His family wants to thank you. And Holloway? A long pause. Vickers raised an eyebrow. Pritchard looked at her hands. Dr. Holloway's actions during the code are being reviewed. There are concerns about his judgment under pressure. The fact that he didn't recognize a tension pneumothorax and then tried to prevent life-saving treatment. She met Claire's eyes. You're not fired, Ms. Bennett. Or Lieutenant, whatever we're supposed to call you. Claire's fine. Claire. Pritchard's voice softened. I owe you an apology. We all do. The way you've been treated here doesn't matter now. Claire stood. I need to go pack. Vickers handed her a card. Call this number when you're ready to arrange transport. And Lieutenant, it's good to have you back. They left. Pritchard lingered at the door. For what it's worth, you saved that young man's life. I hope wherever you're going, they appreciate what you can do. Claire nodded once. Pritchard left. She sat alone in the conference room for another minute, listening to the muffled sounds of the ER beyond the walls. Codes being called, monitors beeping, doctors shouting orders, the machinery of emergency medicine grinding forward. Somewhere in that chaos, David Ruiz was alive because she'd stopped being invisible. She picked up Vickers' card, turned it over in her fingers. Part of her wanted to throw it away, drive to Canada, disappear for real this time. But that wasn't who she was. She tried being nobody, tried blending in, tried letting other people make the calls while she stood quietly in the corner. It hadn't worked, wouldn't ever work, because the truth was simpler and harder than she wanted to admit. She wasn't built for quiet. She was built for the moment when everything fell apart and someone needed to step up. Claire stood, straightened her scrubs, and walked out of the conference room. The security guards looked uncertain. She ignored them, walked back toward the ER. Holloway was at the nurse's station, arguing with Chen. He saw Claire and his face went pale. You can't be here. Relax, Marcus, Claire's voice cut through his panic. I'm leaving. She went to her locker, pulled out her bag, her jacket. Other nurses watched her, some guilty, some confused, some beginning to understand they'd completely misread who she was. Claire walked past them all, past Holloway, who'd shrunk into himself, already knowing his career was circling the drain, past Chen, who nodded with something like respect, past the security guards who didn't try to stop her anymore. She paused at the ambulance bay doors. Through the reinforced glass, she could see the Denver skyline, lights beginning to glow in the twilight. Somewhere out there, David Ruiz's family was gathering in a waiting room, grateful their son was still breathing. Behind her, the ER hummed with organized chaos. Ahead, something much worse waited, a deployment to somewhere ugly, doing things that would leave more scars on top of the ones she already carried. Claire pushed through the doors into the cool evening air. 3 steps out, her phone buzzed. A text from an unknown number. Flight leaves 600 Thursday. Wheels up whether you're on it or not. Don't make us come get you again. V. She almost smiled. Almost. Then she walked toward the parking lot, leaving behind the hospital that never saw her coming, carrying skills nobody had wanted until somebody needed them. The quiet nurse was gone. The soldier was heading back to war. The apartment was exactly how she'd left it that morning. Sparse, functional, impersonal. Claire dropped her bag by the door and stood in the center of the living room, looking at the space like it belonged to someone else. A futon that doubled as a couch. A single lamp. No pictures on the walls. No plants. Nothing that suggested anyone actually lived here. She'd been in Denver for 6 months and hadn't bothered to unpack half her boxes. Some part of her had known she wouldn't stay. Her phone buzzed again. Different number this time. She almost ignored it, then saw the area code. North Vale's main line. Bennett. Claire? It's Amanda, from the ER. The voice was hesitant, young. Amanda Torres, one of the newer nurses who'd started 3 months ago. I'm sorry to bother you, but David Ruiz's sister is here. She's asking for you. Claire closed her eyes. I'm not coming back tonight. I know, I told her, but she's insistent. She said, Amanda's voice dropped to a whisper. She said you saved her brother's life, and everyone's acting like it didn't happen. Dr. Holloway won't even talk about it. And there are hospital administrators everywhere going through records asking questions. That's not my problem anymore. Claire, Amanda's voice cracked. I've been working in that ER for 3 months, and you're the only person who's treated me like I have a brain. The only one who actually listens when I say something seems wrong. And tonight I watched you do something none of those doctors had the guts to do. Claire said nothing. I needed you to know that. Whatever happens next, wherever you're going, some of us saw you, really saw you. The line went quiet except for the ambient noise of the ER in the background. Tell David's sister he's going to be fine, Claire said finally. Tell her to make sure they keep him immobilized until the spine imaging is clear, and tell her... She paused. Tell her I'm glad I was there. I will. Thank you. Amanda hung up. Claire set the phone on the counter and walked to the window. Denver sprawled below her, a grid of light stretching toward the mountains. She'd chosen this city because it was far from everything she'd known, far from the bases and the briefings and the body bags. Turned out distance didn't matter when you carried the war inside you. She pulled out the card Vickers had given her, stared at the number printed in clean black text. One call and she'd be back in it, the machinery of deployment, the weight of carrying skills that kept people alive in situations designed to kill them. But what was the alternative? Stay here, where people looked through her like she was furniture? Where competence was punished if it didn't come with the right credentials. She made the call. Vickers answered on the first ring. Lieutenant? I'm in. Smart choice. Transport will pick you up Thursday at 0400. Pack light. Everything else will be provided at Bragg. What's the deployment? Can't say over an open line. You'll be briefed when you arrive. His voice shifted, became almost conversational. For what it's worth, Bennett, we tried to give you space, let you decompress, but the situation's deteriorated faster than anyone anticipated. You're the only one with the specific combination of trauma experience and security clearance we need. I understand. Do you? Vickers paused. Because we both know you left for a reason. And now we're asking you to go back to exactly what broke you in the first place. Claire watched her reflection in the dark window, pale skin, tired eyes, the same face she'd seen in the mirror for years, but somehow different now, harder. I wasn't broken, she said quietly. I was angry. At what? At everyone who died because someone hesitated, someone second-guessed, someone followed protocol instead of doing what needed to be done. She touched the glass, her fingers leaving faint marks. Tonight, I watched it almost happen again, and I'm tired of being angry. Vickers was quiet for a moment. Then come help us make sure it doesn't happen to anyone else. We'll see you Thursday. He disconnected. Claire stood at the window for another hour, not thinking, just existing in the space between decisions. Then she started packing. Thursday morning came cold and dark. The transport vehicle arrived at 3:57, a black SUV with government plates and 2 soldiers in civilian clothes. They didn't introduce themselves, just loaded her single duffel bag and held the door. The drive to the airfield took 40 minutes. Nobody spoke. Claire watched Denver disappear in the rear-view mirror, the city she'd tried to hide in becoming just another place she'd left behind. The plane waiting at the private terminal was military, a C-130 configured for personnel transport. Claire climbed the ramp and found 6 other passengers already strapped in. All of them had the same look, experienced, weathered, carrying the kind of exhaustion that came from too many deployments and not enough time between them. A captain across from her nodded. You the trauma specialist? I'm a nurse. He smiled grimly. Heard you're a little more than that. Word is you worked with the 274th. 4 years. Then you know what we're flying into. Claire didn't answer. The ramp closed. Engines roared to life. Within minutes, they were airborne, Denver falling away beneath them as they climbed into the pre-dawn darkness. The flight to Fort Bragg took 3 hours. Claire dozed fitfully, her mind cycling through muscle memory. Trauma protocols, triage categories, the weight of equipment in a medical ruck. Her hands moved in her sleep, practicing procedures she hadn't performed in months. They landed at Bragg just after dawn. The base looked the same as every other military installation she'd seen. Uniform buildings, chain-link fences, soldiers moving with purpose through the morning routine. But there was an edge to it. an intensity that suggested something was happening beyond the normal operational tempo. Vickers met her on the tarmac. "Welcome back, Lieutenant. You remember how this works?" Unfortunately, he led her to a nondescript building near the airfield through security checkpoints that required retinal scans and biometric verification. They descended 2 levels underground into a briefing room where a dozen people sat around a conference table covered in maps and satellite imagery. A colonel at the head of the table looked up when Claire entered. "Lieutenant Bennett, good. We can start." Claire sat. The colonel, his nameplate read Morrison, didn't waste time with pleasantries. 18 hours ago, a joint task force conducting operations in the Ghazi region came under sustained attack. Multiple casualties. Their embedded medical team was hit in the initial barrage, 2 KIA, 1 critical. They managed to stabilize and extract their wounded, but the mission's still active and they need a trauma specialist who can operate in hostile conditions. He pulled up a map on the screen. Red circles marked engagement zones. "The region's gone hot. Local insurgents are hitting our forward positions hard, trying to push us out before we can complete the objective. The task force has managed to hold, but they're taking casualties faster than they can evacuate. That's where you come in." Claire studied the map. How fast is faster than they can evacuate? 6 wounded in the last 12 hours. 2 urgent surgical, 4 expectant if they don't get treatment soon. Nearest combat support hospital is 3 hours by air, but the LZ's under intermittent fire. They can't risk medical evac until the situation stabilizes. So you need someone on the ground. We need someone who can keep them alive until we can get them out. Someone who's worked in this exact scenario before. Morrison's eyes locked on hers. "Your file says you performed 11 thoracotomies in field conditions, managed 3 mass casualty events with limited resources, kept a platoon alive for 16 hours after their position was overrun and their medic was killed. That was a long time ago. Muscle memory doesn't forget." He leaned forward. "I'm not going to lie to you, Lieutenant. This is dangerous. The situation's volatile. We're asking you to insert into an active combat zone with minimal support and keep American soldiers breathing until we can pull them out. If you say no, we'll find someone else, but they won't be as good as you." Claire looked at the map, at the red circles marking where people were bleeding and dying, at the timeline showing how long it would take to extract them when they stabilized. "What's the objective?" she asked. "Why can't they just pull out?" Morrison glanced at Vickers, who nodded. "There's a high-value target in the region, someone we've been hunting for 3 years. Intelligence finally pinned his location. The task force was sent to capture or eliminate. They got close, very close, but the operation went sideways when local forces responded faster than anticipated. And you're not willing to abort. We abort now, we lose him. And the opportunity won't come again." Morrison's voice went flat. "This target is responsible for 17 attacks on coalition forces. 43 confirmed kills, including civilians. If we let him slip away because we couldn't maintain pressure..." He didn't finish. Didn't need to. Claire understood the calculus. She'd always understood it. Lives on the ground versus the potential to save lives in the future. Soldiers bleeding now versus preventing the deaths of soldiers who didn't even know they were targets yet. It was the math that made you sick if you thought about it too long. "When do I leave?" 6 hours, you'll insert with a resupply flight, link up with the task force, and establish a forward trauma post. Vickers will be your liaison. Any support you need, you go through him. Equipment? Full trauma kit plus whatever you specify. We're not sending you in unprepared. Claire nodded. I'll need a list of current casualties, medical histories if available, blood types, any allergies or contraindications on file. You'll have it within the hour. Morrison stood, which meant the briefing was over. Everyone else rose. Vickers caught Claire's arm as she turned to leave. You okay? No. She met his eyes. But I will be. Maz. The next 5 hours blurred. Claire went through the medical supply depot like a woman possessed, pulling equipment with the speed of someone who'd done this too many times. Chest tubes, surgical kits, trauma dressings, tourniquets, IV supplies, antibiotics, painkillers. She checked expiration dates, tested equipment, organized everything into loadout bags that could be grabbed in seconds. A staff sergeant working the depot watched her with undisguised awe. Ma'am, most people take half a day to requisition this much gear. Most people haven't had to work out of a rucksack while getting shot at. He laughed nervously. Right. You need help loading this? I've got it. By 1300 hours, she was ready. By 1400, she was suited up in body armor and combat fatigues that felt both foreign and familiar. By 1500, she was boarding a V-22 Osprey that would take her to the staging area, then into the zone. Vickers walked with her to the aircraft. Remember, you're there to keep them alive, not to fight. If things go completely sideways, you get yourself to the extraction point and we'll pull you out. What about the wounded? You do what you can, but you don't die trying to save someone who's already gone. Understood? Claire didn't answer. They both knew she wouldn't follow that order if it came down to it. The Osprey lifted off with a roar. Claire strapped in next to her medical bags and watched Fort Bragg disappear below. Around her, 5 other soldiers sat in silence, an ODA team heading back to their unit, faces hard and eyes distant. The flight took 7 hours, including 1 refueling stop at an undisclosed location. Claire tried to sleep but couldn't. Her mind kept cycling through scenarios, running through procedures, calculating response times and blood loss rates. Night had fallen by the time they reached the staging area, a small forward operating base carved out of hostile territory, all concrete barriers and guard towers and nervous young soldiers pulling perimeter duty. The Osprey landed hard, kicking up dust. Claire grabbed her bags and followed the ODA team out into the darkness. A major met them on the tarmac. Lieutenant Bennett? That's me, Major Reeves. I'm running this FOB. Your ride to the task force leaves in 20 mics. We'll get you fed and briefed in the meantime. He led her to a plywood structure that served as both command post and mess hall. Inside, a dozen soldiers moved between radios and computer terminals, tracking operations across the region. The walls were covered in maps marked with unit positions and threat assessments. Reeves handed her an MRE. Eat fast. The flight to the task force's position is going to be rough. We're skirting contested airspace, and they've been taking pot shots at anything that flies. Claire tore open the meal pouch. What's the current situation? Fluid. The task force has secured a compound where they believe the HVT was hiding. He's already gone, slipped out before they arrived, but they're holding position in case he returns, or in case intel pans out about his next location. Problem is, the compound's in the middle of a neighborhood that's turned hostile. They're taking fire daily, sometimes hourly, and the wounded are stacking up. How many? 8 now. 2 critical, 3 urgent, 3 routine. The critical cases need surgery or they won't last another day. The urgent cases will become critical if they don't get treatment soon. Claire chewed mechanically. And the task force can't pull back? Orders from above. The HVT's too valuable. We hold until we get him, or until the situation becomes untenable. Reeves's expression darkened. Personally, I think we're past untenable, but nobody asked me. 20 minutes later, Claire was loading onto a Blackhawk with her medical gear and 2 pallets of ammunition and supplies for the task force. The crew chief strapped her in, then gave her a headset. Stay tight, ma'am. It's going to get bumpy. The helicopter lifted off into the night. Through the open door, Claire could see the landscape below. Dark villages, scattered lights, terrain that looked peaceful from altitude, but was anything but. The crew chief manned the door gun, scanning for threats. 15 minutes into the flight, tracers arced up from the ground. The Blackhawk banked hard, evasive maneuvers throwing Claire against her restraints. The door gun opened up, red tracers spitting back at whoever was shooting. Then they were clear, racing low over ridgelines, the pilots pushing the aircraft as fast as it would go. 2 minutes, the crew chief shouted. Claire checked her medical bags one last time. Everything was secure. Everything was ready. The Blackhawk flared hard, settling onto a makeshift landing zone inside a walled compound. Before the skids touched ground, soldiers were rushing out to unload supplies. Claire unbuckled and jumped down, her boots hitting dirt as rotor wash whipped dust into her face. Someone grabbed her arm. You the doc? Trauma nurse. Where are the casualties? This way. He led her across the compound at a run. The space was maybe 50 meters square, surrounded by high walls, pockmarked with bullet holes. Guard positions on the corners. A few hardened structures in the center that looked like they'd been repurposed from whatever the compound's original function had been. They ducked into one of the structures. Inside, the smell hit her immediately. Blood, sweat, antiseptic, and underneath it all, the sweet, sick odor of infection starting to take hold. 8 men lay on cots arranged along the walls. Some unconscious, some staring at the ceiling. One was quietly crying. A medic looked up when Claire entered. He was young, maybe 23, with exhaustion stamped into every line of his face. "Thank God. I'm Corporal Hayes. I've been trying to keep them stable, but I'm in over my head." Claire dropped her bags and did a rapid assessment. The 2 critical cases were easy to spot, one with a sucking chest wound that Hayes had packed but needed surgical repair, another with a tourniqueted leg that had clearly taken shrapnel from an IED. The leg was swollen, discolored. Compartment syndrome was setting in. "How long has that tourniquet been on?" Claire asked, pointing. 11 hours. 11... She stopped herself. "Okay, doesn't matter now. We need to deal with it or he's going to lose the leg." She turned to Hayes. "Can you assist?" "I'll do whatever you need." Claire started unpacking equipment. "Get me IV access on both critical cases. Start fluid resuscitation. I need vital signs every 15 minutes. And find me a space with decent light. I'm going to have to operate." Hayes' eyes widened. "Here? In the compound? Unless you've got a surgical suite I don't know about." "But the conditions are better than letting them die." Claire's voice was sharp but not unkind. "I've done this before, Hayes. Just follow my lead and we'll get through it." He nodded, some of the panic leaving his face. "Yes, ma'am." For the next 3 hours, Claire worked with a focus that bordered on supernatural. She opened the chest wound under field conditions, repaired the damaged lung tissue, placed a proper chest tube, and closed with sutures that would hold until real surgeons could do a better job. The soldier, a sergeant named Kowalski, never woke up. Probably for the best. The leg was worse. She had to perform an emergency fasciotomy to relieve the pressure, cutting through tissue that should have been pink and healthy, but was instead gray and dying. Blood that had been trapped gushed out, along with fluid buildup that had nowhere else to go. She cleaned the wound, debrided dead tissue, packed it with gauze soaked in antiseptic. "Will he keep the leg?" Hayes asked quietly. "Maybe, if we can get him to a real hospital in the next 24 hours, and if there's no systemic infection." Claire didn't sugarcoat it. "If we can't, he'll lose it, but at least he'll be alive." She moved through the remaining casualties with systematic efficiency. Started antibiotics, changed dressings, adjusted pain medication, reassessed vitals. 2 of the routine cases were actually worse than classified. She upgraded them to urgent and put them on her watch list. By the time she finished initial treatment, it was past midnight. Hayes had assisted without complaint, learning on the fly, asking smart questions when he wasn't sure. The kid was good. Would be better if he survived long enough to get proper training. Claire stepped outside the aid station to breathe air that didn't smell like trauma. The compound was quiet except for the soft murmur of soldiers on watch. Stars overhead, brilliant in the absence of light pollution. For a moment, it was almost peaceful. Then automatic gunfire cracked in the distance. Everyone in the compound tensed. The shooting continued for maybe 30 seconds, then stopped. A lieutenant approached her. "You Lieutenant Bennett?" "Yeah, I'm Carson, XO for this mess." He was early 30s, hard face, eyes that had seen too much. "Glad you're here. Those men wouldn't have lasted another day without you." "They're not out of danger yet." "I know, but you gave them a chance." He gestured toward the eastern wall. "Captain wants to see you. He's in the command post." Claire followed him across the compound to a reinforced structure that housed communications equipment and tactical displays. Inside, a captain sat hunched over a map, marking positions with a grease pencil. He looked up when they entered. "Lieutenant Bennett, I'm Captain Stiles. Welcome to Paradise." "Thanks for having me." He almost smiled. "Heard you've already performed surgery. That was fast." They couldn't wait. No, they couldn't. Stiles straightened, rolling his shoulders. "I'm going to be straight with you. This situation is deteriorating. We've been in this compound for 4 days. Every day the locals get bolder. Every night we take fire. Intelligence says the HVT is still in the area, but we haven't had solid confirmation in 48 hours. So why are we still here? Because someone with more stars than me says this target is worth the risk." His voice was bitter. "And because every time we start talking about pulling out, we get another lead that seems promising." Claire understood. This was the part nobody talked about in briefings. The inertia of commitment, the sunk cost fallacy playing out with human lives. They'd invested so much already that abandoning the mission felt like admitting defeat. How long until they make a decision? She asked. Could be hours, could be days. Stiles met her eyes. Can you keep those men alive that long? I can try. That's all I'm asking. An explosion shook the compound. Dust rained from the ceiling. Shouting erupted from the walls. Contact East, someone yelled. RPG. Stiles was moving before the echo faded, grabbing his rifle, running for the wall. Claire followed on instinct, staying low. They reached the eastern position just as another explosion hit outside the compound, close enough to spray debris over the top of the wall. Suppressing fire! Stiles shouted. The soldiers on the wall opened up, their weapons strobing in the darkness. Tracers reached out toward muzzle flashes in the buildings across the street. The noise was overwhelming, a physical thing that hammered Claire's chest. Then, just as suddenly as it started, it stopped. The enemy fire cut off. The compound went quiet except for the ringing in everyone's ears. Cease fire, Stiles ordered. Conserve ammo. The soldiers lowered their weapons but stayed alert, scanning for threats. Claire realized she was breathing hard, adrenaline flooding her system. Combat wasn't her job, hadn't been for months, but her body remembered how to react. They're probing our defenses, Carson said quietly beside her. Testing response times. They'll hit us for real soon. How soon? Tonight? Tomorrow? Whenever they think they've got enough fighters. He looked at her. You should stay in the aid station. If this kicks off, that's where you'll be needed. Claire nodded and headed back across the compound. Inside the aid station, her patients were awake and afraid. The explosions had rattled them. Are we about to get overrun? Kowalski asked, his voice weak. No, Claire lied smoothly. Just harassment fire. They're trying to keep us nervous. Is it working? Probably. That got a few weak laughs. Claire checked vitals, adjusted IV drips, made sure everyone was as comfortable as possible under the circumstances. Hayes sat in the corner, cleaning his rifle with shaking hands. First real contact? Claire asked him. Yeah, we trained for it, but... He trailed off. It's different when people are actually trying to kill you. How do you handle it? Claire thought about that. You focus on what you can control. Keep your people alive. Do your job. The fear doesn't go away, but you learn to work through it. Does it ever get easier? No, but you get better at pretending it does. Hayes nodded slowly, went back to cleaning his weapon. Claire settled into a plastic chair near the door, her own rifle across her lap. She'd been issued one when she arrived, standard protocol for anyone in a combat zone. She'd qualified expert every year she'd been in service, but actually using it had always felt like admitting defeat. Her job was keeping people alive, not killing them. But circumstances had a way of making you compromise. The night crawled forward. Every hour brought new sounds. Distant explosions, sporadic gunfire, the roar of jets overhead flying missions she couldn't see. Claire dozed in the chair, waking at every loud noise, checking her patients, adjusting treatments. Around 0300, one of the urgent cases, a private named Martinez, started showing signs of deterioration. His blood pressure dropped. Temp spiked. Claire examined him and found the wound on his abdomen had become infected despite the antibiotics. The tissue around it was inflamed, angry red spreading outward. Hayes, she said quietly, I need to reopen this wound. There's an abscess forming. The corporal looked gray. Now? Right now. Get me a clean field and fresh gloves. She worked by the light of a headlamp, cutting through sutures she'd placed hours earlier, draining infection that had built up beneath the surface. Martinez groaned but didn't fully wake. The pain medication was keeping him under. Claire irrigated the wound cavity, packed it open, started a different antibiotic cocktail. Will he make it? Hayes whispered. If the infection doesn't go systemic. Claire stripped off her gloves. We need to get him evacuated soon, all of them, really. The longer they stay here, the worse their chances. Captain's trying, but the LZ is still too hot for medical evac. Then we make it not hot. Hayes blinked. How? That's above my pay grade. But someone needs to figure it out before these men run out of time. Dawn came slowly, gray light filtering through the aid station's small windows. Outside, Claire could hear the compound waking up. Soldiers going through morning routines, checking weapons, reinforcing positions. The smell of coffee drifted in, incongruous and almost comforting. Styles appeared in the doorway. How are they? Stable. For now. Claire stood, her back protesting from hours in the plastic chair. But that won't last. Martinez needs a higher level of care. So does Kowalski. The others can hold longer, but not indefinitely. I know, I'm fighting for an evac window, but Command is saying another 6 hours minimum before they can risk it. 6 hours might be too late for Martinez. Styles' jaw tightened. Then we better hope he's tougher than the timeline. He turned to leave, then stopped. For what it's worth, Lieutenant, I'm glad you're here. Most medical personnel would have refused this assignment. Too dangerous. Too unpredictable. Most medical personnel have better sense than me. Maybe. Or maybe they just don't understand what it means to be needed. He left. Claire walked outside to clear her head, to breathe air that didn't taste like blood and fear. The compound looked different in daylight, smaller, more vulnerable. The walls that had seemed imposing at night were barely 12 feet high, crumbling in places, pockmarked by years of conflict. From the eastern wall, she could see the neighborhood beyond. Low buildings, narrow streets, a few civilians moving cautiously between structures. Somewhere out there, an enemy force was gathering, planning, waiting for the right moment to strike. And somewhere, maybe in one of those buildings, maybe already gone, was the high-value target that had turned this whole operation into a siege. Claire was about to head back inside when Carson came running across the compound. "We've got movement," he said, breathing hard. "Surveillance just picked up a large group massing 2 blocks east, maybe 30 fighters. They're armed, and they're coming this way." Styles emerged from the command post. "Sound alert, everyone to positions. Get the AT-4s ready and make sure..." The first rocket streaked over the wall and exploded in the center of the compound. The blast picked Claire up and threw her sideways. She hit the ground hard, ears ringing, vision blurred. Somewhere nearby, someone was screaming. Then the world erupted in gunfire and chaos, and she realized the attack Hayes had predicted was happening now. Claire's vision cleared in fragments. Dirt, smoke, a piece of shrapnel embedded in the wall, 6 inches from her head. Her ears screamed with tinnitus, but underneath it, she could hear voices shouting, weapons firing, the distinctive crack of incoming rounds hitting concrete. She pushed herself up. Her left arm didn't want to cooperate. Something had struck her shoulder, not penetrating, but bruising deep. She ignored it and ran for the aid station in a crouch, staying low as bullets snapped overhead. Hayes was already dragging their patients away from the exterior wall. 2 of them were screaming. Kowalski had ripped out his IV trying to find cover. Martinez was unconscious, which was probably a mercy. "Get them to the interior room," Claire shouted over the noise. "Away from the walls!" Another explosion rocked the compound, this one closer. The building shuddered, dust cascaded from the ceiling. One of the light bulbs shattered, plunging half the room into shadow. Claire grabbed her medical bags and helped Hayes move the wounded. They dragged cots and carried those who couldn't walk, shuttling them into a reinforced storage room at the building's core. It was cramped and dark, but the walls were thicker, concrete instead of plywood. Outside, the volume of fire was insane. She could distinguish at least 3 heavy machine guns, maybe more, all pouring rounds into the compound. The task force was returning fire, but they were outnumbered and everyone knew it. "Stay here," Claire told Hayes. "Keep pressure on anyone who starts bleeding. I need to see if there are new casualties." "You can't go out there." She was already moving. Through the main aid station, now half demolished from a rocket that had punched through the roof and detonated in the far corner. Out into the compound where smoke hung thick and acrid. The eastern wall had soldiers crouched behind sandbags, firing controlled bursts at targets she couldn't see. Brass casings littered the ground. Carson spotted her and waved frantically. "We've got wounded at position 3. Claire ran toward the northern wall, her medical bag bouncing against her hip. She found 2 soldiers down, one clutching his leg where a bullet had torn through his calf, the other not moving at all. She checked the still one first. No pulse. Exit wound through the back of his skull. Nothing she could do. The leg wound was survivable. She tourniqueted it above the knee, tight enough to stop the arterial bleeding. The soldier, couldn't have been older than 20, stared at her with wide, terrified eyes. "Am I going to die?" "Not today." Claire marked the tourniquet time on his forehead with a marker from her kit. "But you need to get to the aid station. Can you move?" "I think so." "Then go. Now." He limped away, using his rifle as a crutch. Claire turned back to the dead soldier and felt nothing. No grief, no horror, just the cold assessment that he was gone and others needed her more. She'd felt it before, the shutdown that happened when things got bad enough. Emotions were a luxury for after. Something whistled overhead. She looked up in time to see a mortar round arc into the compound and slam into the command post. The explosion was massive, a pressure wave that knocked her flat. Debris rained down. When she could see again, the command post was rubble and flames. "Stiles!" Carson was running toward the wreckage, screaming. "Captain!" Claire got to the debris before he did. Heat radiated from twisted metal and splintered wood. She could see a hand protruding from the rubble, not moving. Started pulling away chunks of concrete, burning her palms, not caring. Carson joined her, both of them digging with desperate speed. They uncovered Stiles after 30 seconds that felt like hours. He was alive but badly hurt. Compound fracture of the left femur, shrapnel wounds across his torso, possible internal bleeding. His eyes were unfocused, shock setting in. "Get him to the aid station," Claire snapped at Carson. "I'll stabilize him there." "I can't leave the wall." "You're the XO. That makes you in command now. And your captain is going to bleed out if someone doesn't treat him in the next 5 minutes." Carson's face went through several emotions before settling on grim acceptance. He lifted Stiles in a fireman's carry and ran for the aid station. Claire followed, already calculating what she'd need. Femur fractures were tricky, massive blood loss if the bone fragment severed the femoral artery. She'd have to splint it, start transfusion, hope he didn't code before she could get him stable. They got Stiles into the storage room where the other wounded were packed like sardines. Claire went to work immediately, cutting away his pants, assessing the damage. The bone had punched through the skin. Open fracture, high infection risk. Blood pooled beneath him. "Hayes, I need an IV in his other arm, wide bore, and get me 4 units of O negative from the cooler. We only have 6 units left total, then we use 4 of them. Move." She realigned the fracture as best she could, the broken bone grinding as she manipulated it back into position. Stiles groaned but didn't wake. She packed the wound, applied a traction splint to stabilize the leg, started the transfusion. His blood pressure was dangerously low, 80/40, and dropping. "Come on," she muttered, watching the monitors. "Don't you die on me." The building shook again. More explosions, more gunfire. Through the thin walls she could hear soldiers shouting orders, calling for ammunition, reporting enemy positions. The task force was holding, but barely. Martinez opened his eyes. "What's happening? We're under attack." Claire didn't sugarize it. "Stay down and stay quiet." "Are we going to make it?" She looked at him, young, scared, infected wound weeping through fresh dressings, and chose honesty. "I don't know. But if we do, it's going to be because everyone does their job and nobody gives up." He nodded and closed his eyes again. Stiles' pressure started climbing, 90/50, still low but trending upward. The transfusion was working. Claire allowed herself one breath of relief before moving to check the others. 2 had minor injuries from debris. She cleaned and dressed them quickly. The rest were stable, though terrified. Hayes sat against the wall, reloading magazines with shaking hands. "How long can they keep this up?" "The enemy? As long as they want." Claire wrapped a bandage around a soldier's lacerated arm. "They're not in a hurry. They can just sit back and pound us until we run out of ammunition or bodies to hold the walls." "That's not encouraging." "You asked." The radio on Carson's belt crackled. He'd left it in the aid station when he brought Stiles in. Claire picked it up. "Need reinforcements at the south wall. We're getting flanked. Ammo count critical. Recommend rationing." "Where the hell is our air support?" She keyed the transmit button. "This is Bennett. Where's Carson?" Static, then, "He's on the east wall." "Who is this?" "Medical. Tell him Captain Stiles is stable but critical. He needs evacuation in the next 12 hours or he won't make it." "Copy. We'll pass it along. Stay off the command net unless it's urgent." The radio went silent. Claire set it down and went back to her patients, checking vitals, adjusting medications, buying time they might not have. The attack continued for another 40 minutes. Then, gradually, the incoming fire decreased, stopped. The compound went quiet except for the ringing in everyone's ears and the moans of the wounded. Claire emerged from the aid station into daylight filtered through smoke. The compound looked like a war zone because it was one. Craters pockmarked the ground. One building was completely collapsed. Bodies lay near the walls, some theirs, some enemy fighters who'd gotten close enough before being cut down. Carson was at the eastern wall, staring out at the neighborhood beyond. His face was streaked with soot and blood, none of it his. Casualty count? Claire asked. 3 dead, 7 wounded, not counting the ones you already had. His voice was hollow. We dropped maybe 15 of theirs, but there are plenty more where those came from. What about evac? Command says another 4 hours minimum. The LZ is still too hot, and they won't risk a bird until it cools down. Stiles doesn't have 4 hours. None of the critical cases do. Carson turned to look at her. Then what do you suggest? Make the LZ safe. Push out. Clear the area. With what? He gestured at the compound. I've got 18 effective fighters left. We're low on ammo. We've got wounded who can't move, and there's probably 100 hostiles out there waiting for us to do something stupid like leave the compound. Claire was about to respond when one of the soldiers on the wall called out, Lieutenant, you need to see this. They climbed to the observation position. The soldier handed Carson a pair of binoculars and pointed toward a building 4 blocks east. Carson looked, went still, then passed the binoculars to Claire. Through the lenses, she could see a group of men setting up what looked like a heavy mortar in the courtyard of a multi-story structure. They worked with the efficiency of people who'd done this before, assembling the tube, stacking rounds, calculating firing solutions. They're going to shell us, the soldier said unnecessarily. That thing gets operational. They can drop rounds on us all day from outside our effective range. How long until they're ready? Carson asked. Minutes. Maybe 10 if we're lucky. Carson lowered the binoculars, his expression grim. We need to take it out. Call in an airstrike. Negative. The voice came from behind them. A Lieutenant Claire hadn't met before, thin, exhausted radio operator badge on his vest. Air assets are committed elsewhere. We're on our own for the next 6 hours minimum. 6 hours? Carson laughed, but there was no humor in it. We'll all be dead in 6 hours. Then we take it ourselves, Claire said. Everyone turned to stare at her. Explain, Carson said slowly. Small team, move fast. Hit the mortar position before they get it operational. Destroy the weapon and fall back. That's suicide. We'd have to move through 4 blocks of hostile territory, hit a prepared position, and extract under fire. We don't have the people or the ammunition for that kind of operation. Then everyone here dies when that mortar starts firing. Claire's voice was flat. You said it yourself. They can sit back and drop rounds on us until there's nothing left. Our only chance is to take it out before it becomes operational. The radio operator shook his head. Even if we could pull it off, who would lead it? Captain's down, Lieutenant Reese is KIA, and you're... He stopped himself. I'm what? Carson's voice had an edge. You're an XO, sir. No offense, but direct action isn't your specialty. Carson looked at Claire. She could see him doing the math, calculating odds, weighing options they didn't have against outcomes they couldn't survive. I'll do it, she said before he could ask. You're medical. I'm also the only person in this compound who's run operations behind enemy lines. She met his eyes. 4 years attached to special operations units. I've been on more raids than anyone here except maybe the captain. And right now he's unconscious in my aid station. You're a nurse. I'm a soldier who happens to have medical training. And if you've got someone more qualified to lead a direct action raid, now's the time to speak up. Silence. Carson rubbed his face. This is insane. Yes? You'd need volunteers. I can't order people to go on what's basically a suicide mission. Then ask for volunteers. He called the remaining soldiers together in the center of the compound. Explained the situation in blunt terms. The mortar would kill them all if they didn't take it out. Air support wasn't coming. They needed a small team to hit it fast. I need 4 volunteers, Carson said. I won't lie to you. This is dangerous. But it's the only option we have. For a long moment, nobody moved. Then Hayes stepped forward. I'll go. You're a medic, and I've been watching Lieutenant Bennett work since she got here. If she thinks we can do this, I believe her. 2 more soldiers volunteered, a sergeant named Diaz and a specialist named Webb, both looking scared but determined. Carson volunteered himself. No, Claire said. You're in command. You stay here and hold the compound. I can't send you out there without... You can and you will. Because if this goes wrong and I don't come back, someone needs to be here to coordinate defense and evac when it finally arrives. She softened her voice slightly. You know I'm right. He knew. Hated it, but knew it. They geared up quickly, light and fast, rifles, ammunition, grenades, minimal equipment. Claire briefed them using a map sketched in the dirt. We move in a file. I'm on point. Diaz, your rear security. Webb, Hayes, middle. We use the buildings for cover, stay off the main streets. We get to this position. She marked a spot 2 blocks from the mortar. Then we split. Diaz and Webb provide cover fire. Hayes and I move on the mortar. We destroy it, grab any intel we can, and extract the same route we came in. What if we encounter heavy resistance? Diaz asked. We break contact and fall back. This isn't about fighting, it's about completing the objective and surviving. And if we can't break contact? Claire looked at him. Then we make them pay for every meter. They moved out through a gap in the northern wall, slipping into the maze of streets beyond. Claire took point, her rifle up, eyes scanning for movement. The neighborhood was eerily quiet. No civilians, no traffic, just empty streets and shuttered windows. They'd covered 1 block when Hayes whispered, "Movement, 2 o'clock." Claire froze. Through a window in a building to their right, she could see shadows moving. At least 3 people, possibly more. Armed. She hand-signaled the team to take cover. They pressed against walls, weapons oriented toward the threat. The shadows moved toward the window. Claire's finger rested on her trigger, ready to fire if they were spotted. The shadows passed by without looking out, moved deeper into the building. Gone. Claire waited 30 seconds, then signaled to continue. They crossed an intersection, moved through an alley, navigated around a burned-out vehicle. Every window was a potential threat. Every doorway could hide an ambush. 2 blocks. 3. The building housing the mortar came into view. 3 stories, concrete construction, good lines of sight in all directions. Claire could see guards on the roof, more in the courtyard. The mortar was almost assembled. They were running out of time. She led the team to a position in an abandoned shop across from the target building. Through the shattered windows, they had a clear view of the courtyard. Claire counted at least 8 fighters, maybe more inside. We're outgunned, Webb whispered. We're always outgunned. Claire pulled a grenade from her vest. That's why we use initiative. She explained the revised plan quickly. Diaz and Webb would create a diversion on the south side of the building, drawing the guards. When they responded, Claire and Hayes would hit the courtyard from the north, destroy the mortar, and retreat before the enemy could reorganize. How do we destroy a mortar with grenades? Hayes asked. Thermite. Claire pulled 2 silver canisters from her pack, military-grade incendiary grenades. These burn hot enough to melt steel. We place them on the mortar tube, pop smoke for concealment, and run like hell. That's the plan? That's the plan. They synchronized watches, 60 seconds until Diaz and Webb would initiate. Claire and Hayes moved to their jump-off point, a collapsed wall that gave them covered access to the courtyard's northern edge. Claire's heart hammered. Not fear exactly, but the spike of adrenaline that came before action. She'd felt it hundreds of times before. Never got used to it. Never wanted to. Gunfire erupted from the south, Diaz and Webb opening up on the building. Immediately, the guards in the courtyard reacted, moving toward the sound, shouting orders. The mortar crew abandoned their work and grabbed weapons. Claire moved, fast and low across the courtyard, Hayes right behind her. They reached the mortar as the last guard disappeared around the corner. Claire pulled the pin on the first thermite grenade, placed it at the base of the mortar tube. Second grenade on the ammunition stack. Smoke, she hissed. Hayes threw a smoke grenade. White clouds billowed, thick and choking. Claire pulled both thermite pins and ran, Hayes matching her step for step. Behind them, the thermite ignited with a roar, white-hot flames melting through metal and cooking off ammunition. The courtyard erupted in secondary explosions, mortar rounds detonating in their crates, shrapnel screaming in all directions. Claire and Hayes made it to cover as the entire mortar position went up in a fireball that punched through the smoke and lit the afternoon sky. Go, go, go! Claire shouted into her radio. They ran, back through the alley, across the intersection, moving as fast as they could while staying low. Behind them, the building was chaos, men screaming, ammunition still cooking off, confusion and smoke everywhere. Diaz and Webb appeared from a side street, falling in behind them. The four-person team moved as one, covering each other, checking corners, maintaining discipline even as their lungs burned and muscles screamed. They were 1 block from the compound when the ambush hit. Gunfire from windows above and to both sides. A coordinated attack, probably set up in case anyone tried what they'd just done. Rounds snapped past Claire's head. Webb went down, clutching his side. "Contact left and right," Diaz yelled, returning fire. Claire grabbed Webb and dragged him into a doorway. Blood soaked through his shirt from a through-and-through that had missed major organs but still hurt like hell. She slapped a pressure dressing on it while Hayes and Diaz laid down suppressing fire. "Can you move?" Claire asked Webb. Yeah, I'm good." "Then we move." Bounding Overwatch. "Diaz, you're first. Go." Diaz ran 20 meters and took cover, started firing. Hayes went next, then Webb, despite his wound, then Claire. They leapfrogged down the street under continuous fire, burning through ammunition, buying meters with bullets. The compound wall came into view. Carson and the others were providing cover fire from the gates, shooting at anyone who tried to follow. Claire's team sprinted the final 50 meters under a hail of covering fire and practically fell through the gate. Hands pulled them inside. The gate slammed shut. They collapsed against the wall, gasping, bleeding, alive. "The mortar?" Carson demanded. "Destroyed," Claire managed between breaths. "Won't be shelling us anytime soon." "Good. Because we've got bigger problems." He pulled her to her feet and pointed at the sky. Claire looked up and felt her stomach drop. Helicopter. But not one of theirs. Russian-made transport, probably sold to local forces years ago. It was circling the compound, just out of effective small arms range. "They're coordinating," Carson said grimly. "That bird's probably talking to fighters on the ground, directing the next assault. And this time, they're going to come with everything they have." The helicopter made another pass, lower this time. Someone inside was definitely observing the compound, mapping defenses, counting people. "Can we shoot it down?" Claire asked. "Not with what we have. We've got one AT-4 left, but it's designed for armor, not aircraft. We'd need a Stinger, and our nearest Stinger team is 40 kilometers away." Claire watched the helicopter circle, thought about the wounded in her aid station, thought about Stiles unconscious and dying by degrees, thought about 18 soldiers trying to hold a compound against odds that kept getting worse. Then she thought about something else, something risky and probably stupid but just possible enough to try. "The AT-4, she said. "Give it to me." Carson stared at her. "You can't hit a moving helicopter with an AT-4. The rocket's too slow. The guidance system's basic." "I'm not going to hit it while it's moving." She met his eyes. "I'm going to hit it when it lands." "It's not going to land." "Yes, it will, because they're going to want to extract their wounded from the mortar position before we can get to them. And when that helicopter settles into that courtyard..." She didn't finish, didn't need to. Carson looked at her like she'd lost her mind. "You want to go back out there, alone, with a rocket launcher, to ambush a helicopter?" "Yes, that's our only chance to take out their command and control." Claire's voice was calm, certain. "Without that bird, they lose coordination. Their next attack will be disorganized, easier to repel. And if they spot you before you can shoot, then I die and you're down one trauma nurse. But the alternative is we all die when they roll over this compound with overwhelming force." Silence. Then Carson reached for the AT-4 stowed against the wall. "If you're not back in 30 minutes, I'm not waiting for you when evac arrives." "Understood." She took the launcher, checked the sight, verified the firing mechanism. It was heavy, awkward, designed for a 2-person team, but she'd have to manage alone. Hayes appeared beside her. "I'm coming with you." "No, you're not." "Yes, I am. You need someone to watch your back. And besides..." He managed a weak smile. "I didn't sign up to watch you have all the fun." Claire looked at Carson, who shrugged. "Your call." She turned back to Hayes, saw determination under the fear, saw someone who was tired of feeling helpless. "Okay," she said. "But you follow my lead, and if I say run, you run. Clear?" Clear. They moved out through the same gap they'd used before. The streets were more dangerous now. Enemy fighters were everywhere, searching, hunting. Claire and Hayes moved like ghosts, using every scrap of cover, every shadow, avoiding contact through sheer patience and timing. It took them 15 minutes to reach a building with line of sight to the mortar position. Claire found a spot on the second floor, a blown-out office with a window facing the courtyard. She set up the AT-4, angling it for the shot, calculating range and trajectory. Hayes watched the street below. They're moving in teams now, organized. This is different from before. They know we hit their mortar. They're taking it seriously now. Claire checked the site again, which means they'll definitely send the helicopter to extract anyone wounded in our raid. And if they don't? Then we wasted 30 minutes and I'm short one rocket. They waited. 5 minutes. 10. Claire's arms ached from holding the launcher ready. Her shoulder throbbed where she'd been struck by debris during the initial attack. She ignored it all and focused on the courtyard. Then, the sound of rotor blades, getting louder. The helicopter appeared, descending toward the courtyard. It was bigger than she'd thought, capable of carrying maybe a dozen people. Perfect. It settled onto the ground, rotor wash kicking up dust. The side door opened. Men ran out, medics or fighters, she couldn't tell. They moved toward the destroyed mortar position, probably looking for survivors. Claire steadied the launcher on her shoulder, flipped the safety, aligned the sight on the helicopter's engine compartment. "Fire in the hole," she whispered. She pulled the trigger. The rocket streaked out with a roar, backblast filling the room with heat and smoke. The projectile covered the 100 meters in under 2 seconds and slammed into the helicopter's fuselage just below the rotor mast. The explosion was catastrophic. The helicopter disintegrated in a ball of flame and shrapnel, pieces tumbling across the courtyard. Secondary explosions as fuel ignited. Men near the bird were caught in the blast, thrown like toys. "Move!" Claire dropped the spent launcher and ran, Hayes right behind her. They hit the street as enemy fire erupted from everywhere. The fighters had seen the rocket trail, knew where it came from. Bullets chewed through walls and windows as Claire and Hayes sprinted toward the compound. They ran through intersections without checking, trusting speed over caution. Behind them, Claire could hear shouting, boots on pavement, the sound of pursuit. They weren't going to make it. Then gunfire from ahead, the compound, providing covering fire. Carson and the others had seen them coming, were suppressing anyone who tried to intercept. Claire and Hayes covered the last block in a desperate sprint and dove through the gate as it swung open. They rolled into the compound, gasping, bleeding from minor cuts where shrapnel had found them. The gate slammed, locked. Enemy fire pinged off the walls but couldn't penetrate. "You actually did it," Carson said, looking at Claire like he'd never seen her before. "You destroyed their helicopter." "Yeah." Claire pulled herself to her feet. "How long until evac?" He checked his watch. 2 hours. Maybe less. Command just radioed. They saw the explosion, know we're in serious trouble. They're prioritizing our extraction. Good. Because we're out of miracles. The next 90 minutes were the longest of Claire's life. She moved between the wounded, checking vitals, adjusting treatments, doing everything she could to keep them alive long enough to get them out. Stiles was stable but unconscious. Martinez was fighting infection. Kowalski's lung was holding. Webb's gunshot wound was painful, but not critical. Enemy fire came in waves, probing attacks, harassing fire. Nothing sustained. They were waiting, regrouping after losing their helicopter and their mortar, planning something bigger. Carson coordinated with command via radio, arranging the extraction sequence. 2 Blackhawks would come in fast and hot, landing just long enough to load wounded and essential personnel. The rest would hold the compound until a second flight could be arranged. "We're not leaving anyone," Claire said when she heard the plan. "We don't have a choice. The birds can't carry everyone in one trip, then make 2 trips closer together, or get more birds. But we're not leaving wounded soldiers to—" The radio crackled. All stations. Be advised, QRF is inbound your location. ETA 15 minutes. They will secure the LZ and cover your extraction. Break. Air assets are also inbound. You will have armed overwatch during evac. Break. Hold what you have. Help is coming. Carson looked at Claire. She saw relief in his eyes, tempered by the knowledge that 15 minutes was still a lifetime in combat. "Pass the word," Carson ordered. "Everyone holds their position. No heroics. We just need to last a little longer." The minutes crawled. Claire stayed in the aid station, ready to move her patients the moment the helicopters arrived. She'd already triaged them. Most critical cases loaded first, walking wounded last. It was cold calculus, but necessary. Then she heard it. Jets screaming overhead. The distinctive roar of a 10 warthogs. the Air Force's close air support platform. They made a pass over the compound, low enough that she could see the pilots in the cockpit. Seconds later, the GAU-8 Avenger rotary cannons opened up. The sound was like nothing else, a deep, tearing roar as 30-millimeter rounds chewed through buildings where enemy fighters had been massing. Explosions blossomed across the neighborhood as the Warthogs eliminated threats with surgical precision. The enemy fire stopped, completely. Whatever force had been preparing to assault the compound was either dead or running. "LZ is clear," someone shouted. "Birds inbound." 2 Blackhawks appeared over the compound, flaring hard, settling into the courtyard. The side doors were already open, crew chiefs waving them in. "Let's go," Claire yelled. "Critical cases first." They moved Stiles on a stretcher, loaded him aboard with practice speed. Martinez next. Kowalski. The other wounded followed, some walking, some carried. The helicopter's turbines never stopped spinning, pilots ready to lift the moment everyone was aboard. Claire did a final count. All the wounded were loaded. Carson was climbing aboard the second bird, waving at her to follow. She started toward the helicopter when Hayes grabbed her arm. "Lieutenant, the aid station. I left my rifle in there." "Leave it. We're out of time." "It's got my name engraved on it. My father gave it to me before I deployed. I can't—" "Go. I'll get it. But go." She ran back to the aid station, into the storage room where they'd sheltered the wounded. Hayes's rifle was there, leaning against the wall where he'd set it during the chaos. Claire grabbed it and turned to leave. That's when she saw the document folder. It was lying half buried under a cot they'd moved. Leather cover, official looking, definitely not part of medical supplies. Claire picked it up, opened it. Intelligence documents, maps, photographs, and at the top of the first page, a name she recognized from the mission briefing, the high-value target, the entire reason they'd been in this compound to begin with, and beneath his name, a location, not where he'd been, where he was going. Tonight. With coordinates and a time, 2100 hours, less than 3 hours from now. Claire stared at the folder. This was command-level intelligence. Someone in the task force had found it, maybe during the fighting, maybe before, and left it here by accident, or because they were killed before they could report it. She heard the helicopter's engines pitch higher, getting ready to lift. This intel could end the hunt, could capture or kill the target they'd lost so many people trying to find. But sharing it meant the mission would continue, meant more soldiers in harm's way, meant asking people to risk what they'd already risked, except this time with the target actually within reach. The helicopter's rotors were screaming now. Carson would be calling for her, wondering why she hadn't boarded. Claire looked at the folder, at the name, at the coordinates. She made her choice. Then she ran for the helicopter, the folder clutched in one hand and Hayes's rifle in the other, knowing that what she was carrying would change everything and everyone aboard those birds had already bled enough for one mission. But some missions didn't end just because you wanted them to. She reached the Black Hawk and climbed aboard. The crew chief pulled her in, and the bird lifted immediately, rotors clawing at the air. Through the open door, she watched the compound fall away. The walls they'd defended, the ground they'd held, the place where they'd lost people whose names she barely knew. Carson leaned over, shouting above the noise. "You okay?" Claire looked at him, at the folder in her hands, at the intelligence that could restart everything they'd just survived. "We need to talk," she said, and handed him the folder as the helicopter banked hard and carried them towards safety that might not last longer than the flight itself. Carson opened the folder and his face went through 3 different expressions in as many seconds. Confusion, recognition, something darker that Claire couldn't quite name. "Where did you find this?" His voice was barely audible over the rotors. "Storage room, under a cot. Someone dropped it or hid it." Carson flipped through the documents, his jaw tightening with each page. "This is the real objective, the actual coordinates for the target, not the compound we just held. That was a decoy or bad intel. This," he tapped the page, "this is where he'll be tonight." Claire leaned closer. The coordinates pointed to a location 30 kilometers west of their previous position. A village marked on the map as Kara, population maybe 200. And in 3 hours, the high-value target would be there for a meeting with local commanders. "We need to pass this up the chain," Carson said, already reaching for the radio. Claire caught his wrist. Wait. Wait. This is exactly what we've been. Look at the timestamp. She pointed to the corner of the document. This intel was acquired 4 days ago, before we even inserted into that compound. Carson stared at the date, then at her. Someone knew. Someone in command knew the real target wasn't at that compound and sent us there anyway. Or someone in the task force knew and didn't report it. Claire kept her voice level. Either way, people died defending a position that didn't matter while the actual target was somewhere else the entire time. The helicopter banked hard, beginning its descent toward the forward operating base. Below, Claire could see the perimeter lights, the landing pad, medics already waiting with stretchers. Carson looked at the folder again. If we report this now, they'll launch another operation. More soldiers. More risk. And if we don't, the target walks and everything we just went through was for nothing. Was it? Carson's eyes were hard. Because from where I'm sitting, we saved 8 wounded soldiers and killed a lot of people who were trying to kill us. That's not nothing. That's the mission. The Black Hawk touched down. Crew chiefs started unloading the wounded, moving with practiced efficiency. Stiles was offloaded first, still unconscious but alive. Martinez next, then the rest. Medics swarmed them, starting assessments, calling for assistance. Claire climbed out and stood on the tarmac, watching the organized chaos. Hayes was helping carry one of the wounded, his rifle slung across his back where she'd returned it. He caught her eye and nodded once. A thank you he didn't need to speak. Lieutenant Bennett. Vickers appeared from between 2 Humvees, walking fast. I need a debrief. Now. The wounded are being handled by people whose job that is. You need to tell me what happened out there. His tone allowed no argument. Claire followed him to a climate-controlled trailer that served as the Tactical Operations Center. Inside, Morrison was waiting along with 2 other officers Claire didn't recognize. Maps covered the walls. Computer screens showed drone feeds and satellite imagery. Sit, Morrison said. Claire sat. Carson entered behind her, still carrying the folder. Morrison noticed. What's that? Intel, Carson said, setting it on the table. Found in the compound. Details the HVT's actual location and timeline, tonight, 3 hours from now. Morrison opened the folder, read for 30 seconds, closed it. Where exactly did you find this? Storage room where we kept the wounded, Claire said. It was under a cot. Could have been dropped during the fighting or placed there deliberately. By who? Don't know. Half the task force is dead or wounded. Could have been anyone. Morrison exchanged a look with Vickers that Claire couldn't read. Then he turned back to the folder, flipping through pages with deliberate slowness. This changes things, he said finally. Yes, sir, Carson replied. If the intel is solid, it's solid. Morrison's voice was flat. I've seen the source reporting. This is legitimate intelligence. The question is why it ended up in a storage room instead of being transmitted up the chain when it was acquired. Silence filled the trailer. Claire watched Morrison's face, saw something shifting behind his eyes. Calculation. Damage assessment. Captain Stiles found this, Morrison said. It wasn't a question. We don't know that, Claire said, but it's the most likely scenario. He was running the operation. He would have had access to any intel that came in, and if he found this 4 days ago, Morrison trailed off, but the implication was clear. Stiles had sat on actionable intelligence, had kept the task force at a compromised position, taking casualties, while the real target was elsewhere. The question was why. Maybe he didn't trust it, Carson offered. Maybe he thought it was a trap. Then he should have reported it and let command make that assessment. Morrison's jaw worked. Instead, he kept quiet, and soldiers died. He's unconscious, Claire said quietly. We can't exactly ask him. No, but we can pull his communication logs, see what he transmitted and what he didn't. Morrison looked at one of the other officers. Get me everything Captain Stiles sent or received in the last week, and I want to know who else had access to this intel. The officer left. Morrison turned back to Claire and Carson. You two are grounded. No more field operations. You've been through enough, and I need you to stay available for questioning as this investigation develops. Investigation? Carson's voice rose. Sir, we have coordinates and a timeline. We could launch right now and actually get this target. And I could be sending soldiers into another bad situation based on intel that's already been compromised. Morrison's tone hardened. Until I know why Captain Stiles sat on this, I'm not authorizing any operation. We've lost enough people chasing ghosts. So the target just walks? Claire asked. The target walks. Morrison met her eyes. Because the alternative is I send more soldiers into the grinder based on intel from a source I can't trust. That's not a trade I'm willing to make. He dismissed them. Claire and Carson walked out into the night air, both silent. Around them, the FOB hummed with activity, soldiers pulling guard duty, vehicles moving supplies, the constant background noise of a forward operating base in hostile territory. He's covering something up, Carson said finally. Maybe. Or maybe he's just being cautious. 4 days, Claire. Stiles sat on that intel for 4 days. That's not caution. That's... He stopped himself. I don't know what that is. They walked to the medical tent where the wounded were being processed. Inside, doctors and nurses worked on stabilizing patients for transport to the larger hospital at Bagram. Claire found Hayes checking vitals on one of the soldiers. How's everyone doing? She asked. Better. Thanks to you. Hayes glanced at the doctors working nearby. They're saying all the critical cases you stabilized should make full recoveries. The chest tube on Kowalski was textbook, and that fasciotomy probably saved Martinez's leg. Claire nodded, but didn't feel the satisfaction she should have felt. 8 soldiers saved, 3 dead, 1 captain unconscious and under investigation, all for a target they'd never actually had a chance to catch. You did good out there, she told Hayes. Better than good. You kept your head when most people would have panicked. I had a good teacher. He managed a tired smile. What happens now? Now we wait. Give statements. Hope someone figures out what actually went wrong. She left the medical tent and headed toward the quarters she'd been assigned, a plywood cube with a cot and her duffel bag. She hadn't slept in almost 40 hours. Her body ached from the combat, the running, the weight of keeping people alive against odds that kept getting worse. She should sleep, should rest while she had the chance. Instead, she pulled out her tablet and logged into the secure network. Started searching through after-action reports, intelligence summaries, communication logs. If Morrison was investigating Stiles, she could do some investigating of her own. It took her 20 minutes to find the first anomaly. A message from Stiles to command dated 3 days ago requesting air support for an operation that never happened. Except the coordinates he'd listed weren't for the compound they'd defended. They were for Kara, the village where the HVT was supposed to be tonight. Claire pulled up more logs, found another message, this one from command to Stiles, denying the air support request due to asset availability. And a third message, Stiles acknowledging the denial and stating he'd proceed with the current mission parameters. She sat back, staring at the screen. Stiles had tried to act on the intel, had requested support to hit the actual target location. Command had denied him, and rather than push back or escalate, he'd accepted it and kept his task force at the decoy position. Why? She kept digging, found a personnel file for Captain Stiles, 15 years in service, multiple deployments, decorated combat veteran. No disciplinary actions, nothing that suggested he'd deliberately endanger his own men. But then she found something else, a medical report from 6 months ago. Stiles had been diagnosed with early-onset post-traumatic stress disorder following his previous deployment. He'd been cleared for duty, but with a recommendation for continued counseling and monitoring. Claire closed the tablet. PTSD didn't make someone incompetent, didn't make them sit on actionable intelligence or fail to protect their soldiers, but it could make them hesitate, could make them second-guess, could make them avoid pushing back against command when command made a bad call. She thought about Holloway in the Denver ER, about how he'd hesitated when David Ruiz needed immediate intervention, about how protocol and hierarchy had mattered more to him than the patient dying in front of him. Different situation, same fundamental failure. Someone in a position of authority freezing when decisiveness was required. A knock on her door pulled her from the thought. Carson stood outside, looking worse than she felt. Morrison wants to see us again, both of us. They walked back to the Tactical Operations Center. Inside, Morrison had been joined by a full colonel Claire hadn't met before. The man's name tape read Brennan, and his expression suggested he'd rather be anywhere else. Lieutenant Bennett? Lieutenant Carson. Brennan's voice was clipped, military precise. I'm the investigating officer for this incident. I've reviewed the communication logs, the intel documents, and preliminary statements from the task force survivors. I need you to walk me through exactly what happened, starting from the moment you arrived at the compound. They did. Claire and Carson took turns describing the defensive operations, the casualties, the raid on the mortar position, the helicopter engagement. Claire mentioned finding the folder but didn't speculate about how it got there or why. Brennan listened without interrupting. When they finished, he pulled out a different folder, thicker than the intel document, marked with classification stamps. Captain Stiles regained consciousness an hour ago, Brennan said. I interviewed him before the doctor sedated him again for surgery. He confirmed he received the Kara intel 4 days ago from a local informant who approached the compound. He transmitted a request for support to hit the location, but was denied due to asset prioritization for another operation deemed higher value. So he tried to do the right thing, Carson said. He tried, and when command denied him, he accepted that decision rather than escalating or pulling his team out of an untenable position. Brennan's expression hardened. That's a failure of leadership. People died because he chose to follow orders he should have questioned. Claire felt something cold settle in her stomach. You're blaming him for obeying command. I'm blaming him for not recognizing when to disobey command. There's a difference. Brennan closed the folder. Captain Stiles will face a formal inquiry when he recovers. His command is terminated, effective immediately. Lieutenant Carson, you're being field promoted to captain and assuming command of what's left of the task force. Carson stared. Sir, I don't have the experience. You have the experience of keeping people alive when everything went wrong. That's more valuable than any training course. Brennan turned to Claire. As for you, Lieutenant Bennett, your actions in the field were exemplary. The wounded you treated are alive because of your skill and decisiveness. I'm recommending you for a Bronze Star with V device for valor. I don't want a medal. What you want is irrelevant. What matters is that your service is recognized. Brennan's voice softened slightly. You could have stayed safe. Could have refused this deployment. Instead, you inserted into an active combat zone and kept soldiers breathing under the worst possible conditions. That deserves recognition. Claire wanted to argue but couldn't find the words. Recognition. The thing she'd never gotten at Northvale, where competence was invisible until someone was dying. The thing Stiles had never gotten from command when he tried to do the right thing with the Kara intel. What about the target? She asked instead. The HVT, are we just letting him go? Brennan and Morrison exchanged another look. Morrison spoke. We're not. I've authorized a strike team to hit the Kara location based on the intel you recovered. They're preparing now. Launch time is in 90 minutes. Who's leading it? Carson asked. Major Reeves from the FOB. He's got a fresh team, Special Operations Detachment that just rotated in. They're equipped and trained for exactly this kind of rapid response mission. Claire felt something unclench slightly. The intel wouldn't be wasted. The target might actually get caught. The soldiers who died defending that compound might get something resembling justice. You're both dismissed, Brennan said. Get some rest. We'll need full statements tomorrow, but for now, you're done. They left the operations center. Outside, the sky was dark except for stars and the occasional navigation light from aircraft overhead. The base felt different now, less temporary, more solid. Or maybe that was just Claire's exhaustion talking. Bronze Star, Carson said quietly. That's not nothing. It's a piece of metal. It's recognition from people who understand what you did. Take the win, Claire. You earned it. She didn't answer. They walked in silence until Carson split off toward his quarters. Claire continued to hers, each step heavier than the last. Inside, she stripped off her body armor and combat fatigues, finally seeing the extent of damage she'd accumulated. Bruises covered her shoulder and ribs. Small cuts from shrapnel marked her arms. Burn marks on her palms from pulling debris off Stiles. Nothing serious, nothing that wouldn't heal. She lay down on the cot and closed her eyes, expecting sleep to come immediately. Instead, she thought about Holloway, about how he'd tried to have her fired for saving David Ruiz's life, about how the hospital administration had sided with protocol over results until military investigators had shown up and revealed who she actually was. Same pattern, different context. People with authority protecting systems instead of people, punishing competence that didn't follow the approved channels. And then she thought about Styles, about a captain who'd tried to do the right thing, been denied, and chosen obedience over his soldiers' safety. Not out of malice, but out of something worse, the belief that the system knew better than the people on the ground. Her tablet chimed. A message from Vickers. Strike team is wheels up in 60. Drone feed will be live if you want to watch. Claire stared at the message. She should sleep. Should let them handle it. She'd done her part. But some part of her needed to see it through. Needed to know the intel she'd found would actually accomplish something. She pulled up the secure feed on her tablet. 4 drone cameras showed different angles of Kara Village. Infrared imagery of buildings, streets, the occasional person moving between structures. The strike team would be inserting via helicopter, hitting the location fast, extracting before enemy reinforcements could respond. The timer in the corner showed 53 minutes until H hour. Claire watched the feed, unable to look away. The village seemed peaceful from this altitude. No indication of the violence about to descend on it. 40 minutes. The feed showed helicopters lifting off from the FOB, 4 dark shapes against darker sky. They flew low, terrain following, invisible to anyone without night vision. 30 minutes. The village remained quiet. Claire started seeing movement, vehicles arriving, people entering one particular building. The meeting was happening. The target was there. 20 minutes. The helicopters were 5 clicks out, approaching from the north. On the ground, the strike team would be doing final weapons checks, reviewing the assault plan, preparing for contact. 10 minutes. Claire's hands were shaking. She couldn't tell if it was exhaustion or adrenaline or something else entirely. 5 minutes. The helicopters flared to a hover 1 click from the village. Ropes dropped. Soldiers fast roped down, hitting the ground and immediately moving toward the target building. 16 operators total, split into 2 teams. 2 minutes. The teams reached their positions. Breaching charges placed. Everyone ready. H hour. The explosions were visible even on infrared. Doors blowing inward, flashbangs detonating, the strike teams flooding into the building. Thermal signatures showed people running, falling, being detained. It was over in 90 seconds. The teams withdrew with 3 detainees, loading them onto the helicopters. One of them matched the facial recognition profile of the high-value target. Positive ID. Mission complete. Claire closed the tablet and set it aside. The target was caught. The intel had been good. The soldiers who'd died holding that compound hadn't died for nothing after all. Except they had. Because the intel had been sitting in a storage room for 4 days while they defended a position that didn't matter. Because Styles had been denied support and hadn't fought harder for it. Because the system had valued one operation over another without understanding the ground truth. And now Styles would face an inquiry. Would probably lose his command permanently. Would become the scapegoat for a failure that started way above his pay grade. Just like Claire had almost become the scapegoat at Northvale for saving a patient whose death would have been blamed on natural causes rather than medical hesitation. The patterns were everywhere once you started looking for them. People punished for doing the right thing when the right thing violated protocol. People rewarded for following procedures even when those procedures got people killed. She thought about the Bronze Star Brennan had mentioned. Recognition for valor. For doing exactly what she'd been trained to do. What she'd done 100 times before. What should have been unremarkable, except that it happened in a place where most people would have been too scared to try. It felt wrong. Not because she didn't deserve it, she'd earned it by any reasonable measure, but because the recognition came only after her background was revealed. When she'd been just a nurse in Denver, her competence had been dismissed. Now that everyone knew she was a decorated combat veteran, that same competence was suddenly praiseworthy. Nothing about her skills had changed, only other people's perception of them. Her tablet chimed again. Different message, this one from an address she didn't recognize. She opened it cautiously. Lieutenant Bennett, this is Dr. Sarah Chen from Northvale Medical Center. I hope this message reaches you. I wanted to inform you that Dr. Holloway has been placed on administrative leave pending investigation into his conduct during the David Ruiz case. The review board found multiple instances where his judgment endangered patient safety. He's also facing potential disciplinary action from the state medical board. I thought you'd want to know. Additionally, the hospital would like to offer you a position as senior trauma coordinator when your deployment concludes. No pressure, but the offer stands. You change things here, more than you probably realize. Dr. Chen. Claire read the message 3 times. Holloway was facing consequences. Real ones, not just a slap on the wrist. And Northvale wanted her back, not as an invisible nurse who got talked over, but as someone whose expertise would actually be valued. It should have felt like victory, like justice finally catching up to someone who'd prioritized his ego over patient care. Instead, it felt hollow. Because Holloway hadn't changed. The system that had enabled him for years hadn't changed. They were just reacting to getting caught, to having their dysfunction exposed by someone they couldn't dismiss. She typed a response. Dr. Chen, thank you for the update. I'm glad David recovered. Regarding the position, I'll need time to consider it. My current commitment may extend longer than initially anticipated. I'll be in touch. Lieutenant Bennett. She sent it and closed the tablet. Outside, she could hear helicopters returning from the Kara raid, rotors beating the air as they settled onto landing pads. Mission accomplished. Target captured. Everyone coming home alive. That's what success looked like in this world. Objectives met. Personnel recovered. Minimal casualties. Claire lay back on the cot, staring at the plywood ceiling. Her body finally acknowledged its exhaustion, muscles relaxing, eyes growing heavy. But her mind kept turning over the same questions. How many Captain Styles were out there, trying to do the right thing, but getting blocked by command structures that couldn't see past their own priorities? How many Dr. Holloways were practicing medicine, their incompetence protected by credentials and hierarchy until someone died in a way that couldn't be ignored? How many people with critical skills were being dismissed and overlooked because they didn't fit the expected profile? And what did it mean that Claire kept finding herself in situations where she had to choose between following the rules and doing what actually needed to be done? She was almost asleep when someone knocked on her door. She considered ignoring it, but dragged herself upright and opened the door. Vickers stood outside, holding a folder. His expression was carefully neutral. What now? Claire asked. Major Reeves just reported in from the Kara raid. Target is confirmed in custody. Solid intel, clean operation, 0 casualties on our side. He paused. They also found something else. Which is? Documents, communications, evidence that the HVT had an intelligence source inside our task force. Someone was feeding him information about our operations, our movements, our plans. Claire felt ice in her stomach. Who? We don't know yet. The intel is fragmentary, code names, partial transmissions. But it's enough to confirm that someone in that compound was working for the enemy. Vickers met her eyes. Someone who might have deliberately misplaced the Kara intel to protect the target. Someone who got people killed to maintain their cover. Styles? Claire asked, though she already knew the answer. Too early to say. Could be him. Could be someone else who had access to his communications and files. The investigation is ongoing. Vickers shifted his weight. The reason I'm telling you this is that Colonel Brennan wants you to remain available for questioning. You were in that compound. You found the intel. You might have seen or heard something that could help identify the source. I barely knew anyone there. I was focused on keeping people alive, which is exactly why you might have noticed something others missed. You weren't part of the social dynamics. You were observing. He handed her the folder. This is what we know so far. Review it tonight. Tomorrow, you'll meet with counterintelligence to discuss what you remember. He left. Claire returned to her cot and opened the folder. Inside were dozens of intercepted communications, surveillance reports, intelligence assessments, all pointing to a mole inside the task force. She read through everything twice, looking for patterns. The information being leaked was specific: convoy routes, patrol schedules, defensive positions. Whoever was feeding it to the enemy had detailed knowledge of operations. Officer-level access at minimum. One document caught her attention, a partial transcript of a radio communication from 3 days ago, intercepted by Signals Intelligence. Someone transmitting from inside the compound to an unknown recipient. Target intel is contained. No action required. Maintain current posture. The timestamp matched the same day Styles had received the denial for air support. The same day he'd decided to keep the task force at the compound instead of pushing to hit Kara. Claire set down the folder and rubbed her eyes. If Styles was the mole, it explained everything. Why he'd sat on the intel. Why he'd accepted command's denial without fighting. Why he'd kept soldiers in a vulnerable position even as casualties mounted. But it didn't explain why he'd requested air support in the first place. Why risk exposing himself by trying to hit the actual target, unless the request had been for show? Cover his tracks. Make it look like he was trying to act on the intel while knowing command would deny him, or unless he wasn't the mole at all and someone else had sent that transmission. She thought about the storage room where she'd found the folder, thought about who'd had access to it. The wounded soldiers, unlikely. Hayes, she'd trust him with her life. Carson, possible but improbable, given how he'd reacted to finding the intel. Who else? The medical supplies had been stored there before she'd converted it into a casualty collection point. The task force medics would have known about it. Anyone doing resupply would have had access, and during the chaos of the fighting, half the task force had probably been in and out of that building at some point. Too many possibilities, not enough evidence. Claire closed the folder and finally, mercifully, fell asleep. She woke 6 hours later to her tablet chiming urgently. Emergency message from Vickers. Stiles just died. Complications during surgery. Never regained consciousness. Investigation continues, but our primary subject is gone. Need your statement ASAP. V. Claire stared at the message. Stiles was dead. The man who might have been a traitor or might have just been a captain trying to survive an impossible situation was gone before anyone could question him properly. Convenient for the investigation, or convenient for whoever actually was the mole. She dressed quickly and headed for the operations center. Outside, the base was on high alert, extra guards at checkpoints, patrols moving with purpose, an energy that suggested something had changed. Brennan was waiting in the operations center along with 2 counterintelligence officers. They spent 3 hours going through Claire's statement, asking about every person she'd interacted with in the compound, every conversation she'd overheard, every detail she could remember. She told them everything. About finding the folder, about Carson's reaction, about Hayes and Diaz and Webb, about the wounded soldiers and the chaos of the fighting. Did Captain Stiles ever speak to you directly? One of the CI officers asked. Once, right before the initial attack. He asked if I could keep the wounded alive long enough for evac. How did he seem? Claire thought about it. Tired, stressed, like someone carrying more weight than he could handle, but committed. He wasn't going to abandon his soldiers. Even if he was feeding intelligence to the enemy, if he was doing that, he hid it well. Claire met the officer's eyes. But I spent maybe 6 hours total in that compound. I'm not the person to ask about his loyalties. They questioned her for another hour before finally releasing her. As she left, Brennan pulled her aside. The strike team found something else in Kara. Another document, this one naming the source inside our task force. He paused. It wasn't Stiles. Claire stopped walking. Then who? Lieutenant Reese, the officer who was KIA during the initial attack on the compound. Brennan's expression was grim. He'd been passing intelligence for 8 months. The enemy knew we were coming before we even inserted. They hit us hard specifically to protect their source and eliminate him before we could discover his betrayal. He's dead. How does that? It means Stiles was clean. It means he died with everyone thinking he was incompetent, or worse, when the real traitor had already been killed trying to cover his tracks. Brennan looked genuinely troubled. It means we owe that man's memory an apology he'll never hear. Claire felt something twist in her chest. Stiles had tried to do the right thing, had been denied support, had kept his team alive as long as he could, had died before anyone could clear his name. And now he'd be remembered as the captain under investigation, the officer who might have been a traitor, just like she'd almost been remembered as the nurse who assaulted a patient. Just like Holloway would eventually be remembered as the doctor who endangered lives. Just like so many people who got caught in the machinery of systems that valued perception over truth. What happens now? She asked. Now we close the investigation. Reese's family will be notified. Stiles' record will be corrected posthumously, and we move forward. Brennan's voice was flat. It's not justice, but it's all we have. He walked away, leaving Claire standing alone in the corridor. She walked back to her quarters in a daze. Stiles was dead and vindicated. Reese was dead and exposed. The HVT was in custody. The mission was technically complete. And she was standing in the middle of it all, alive and decorated and wondering what any of it actually meant. Her tablet showed another message. This one from Morrison. Your deployment orders have been modified. You're being sent back to the States for a 2-week decompression period, then reassignment to a training command. No more field operations. You've done enough. Report to the airfield at 00600 tomorrow. Morrison. Claire read it twice. They were sending her home, taking her off the line, putting her somewhere safe where her skills could be used to train others instead of keeping her in situations where she might get killed. It was the smart call. The right call, even. It felt like failure. She pulled up Dr. Sarah's message again. Read the job offer. Senior trauma coordinator. Recognition. Authority. A chance to actually change how things worked instead of just surviving within broken systems. She typed a response. Dr. Chen, I'll take the position. I can start in 3 weeks. One condition, I have full authority to implement trauma protocols as I see fit, and my decisions in critical situations cannot be overridden by physicians whose ego is bigger than their competence. If the hospital can agree to that, we have a deal. Lieutenant Bennett. She sent it before she could second-guess herself. Her tablet chimed immediately. Dr. Sarah's reply. Agreed. See you in 3 weeks. Welcome home. Dr. Chen. Claire set the tablet down and looked around her quarters. Plywood walls. Military-issue cot. Duffel bags she'd barely unpacked. This wasn't home. Never would be. But maybe Denver could be. Maybe Northvale could be different with someone who knew how to fight pushing for change from the inside. Or maybe she'd just end up right back where she started, fighting systems that were designed to resist exactly what she was trying to do. Either way, she'd find out in 3 weeks. She spent the rest of the day making arrangements, saying goodbyes, preparing for departure. Hayes found her before dinner. Heard you're heading out tomorrow, he said. Yeah, back to the States. Must be nice. He didn't sound envious, just tired. What are you going to do? Hospital job. Trauma coordinator? They're lucky to have you. He extended his hand. Thanks for everything, Lieutenant. You saved my life out there. Probably more than once. She shook his hand. You did good work, Hayes. Keep at it. I will. And if I ever end up in Denver with a medical emergency, I know where to go. He left. Claire walked to the medical tent for a final check on her patients. They were all stabilized, scheduled for transport to Bagram, and then back to the States for continued treatment. Kowalski was awake and arguing with a nurse about his medication. Martinez was sleeping peacefully, his infection under control. Webb's gunshot wound was healing without complications. They'd all make it. All of them would go home alive because she'd been there to keep them breathing when everything else was falling apart. That had to count for something. She returned to her quarters as the sun set, painting the mountains in shades of orange and purple. Tomorrow, she'd fly out. 3 weeks after that, she'd walk into Northvale Medical Center as someone the staff couldn't ignore or dismiss, as someone whose authority came not from credentials, but from proven competence in situations where competence was the only thing that mattered. Her tablet chimed one last time. Message from Vickers. Just got word. The HVT is talking. Giving up his network, his contacts, his future operations. The intel you found didn't just catch him. It's going to dismantle his entire organization. Thought you'd want to know. Fair winds and following seas, Lieutenant. V. Claire smiled despite herself. Fair winds and following seas. The old Navy farewell. Appropriate even if she'd never been Navy. She lay down on the cot one final time, knowing tomorrow would bring transport planes and debriefings and eventually civilian life. Knowing she'd have to figure out how to be someone other than the soldier who kept people alive in war zones. But tonight, she let herself rest. Let herself believe that maybe, just maybe, she'd found a way to do the same work in a different uniform, to fight the same battles against incompetence and hesitation and systems that valued procedure over people. And maybe this time, she wouldn't have to be invisible to be effective. Maybe this time, they'd listen before someone had to die to prove she was right. She closed her eyes and slept without dreaming. The C-17 lifted off from the FOB at dawn, carrying Claire and 40 other soldiers rotating back to the States. She sat near the rear ramp, watching Afghanistan disappear through the small window, brown mountains, scattered villages, terrain that had taken too much from too many people. The flight would take 18 hours with refueling stops. Most of the soldiers slept or played cards or stared at nothing in particular. Claire pulled out her tablet and started drafting implementation plans for Northvale's trauma protocols. If she was going to change how that ER operated, she needed to arrive with more than just authority. She needed a roadmap. Somewhere over the Atlantic, a sergeant sitting across from her leaned forward. You're the one who held that compound, right? Kept all those wounded alive? Claire looked up. I did my job. Heard you destroyed a helicopter with an AT-4. That true? It was stationary. Not that impressive. The sergeant grinned. Still pretty badass. He extended his hand. Thanks for what you did out there. My cousin was one of the wounded you treated. Martinez. He said you saved his leg. Claire shook his hand. Martinez is tough. He did most of the work himself. He said you cut him open in the middle of a firefight without flinching. Someone had to. The sergeant settled back in his seat, still smiling. Well, whoever has you next is lucky. Just wanted you to know that. Claire returned to her tablet but couldn't focus. The conversation had reminded her of something she'd been trying not to think about, the weight of other people's gratitude. The way it felt both validating and uncomfortable, like wearing clothes that fit perfectly but were designed for someone else. She'd spent so long being invisible that visibility felt foreign. The plane landed at Dover Air Force Base in Delaware just after midnight local time. They processed through customs and medical screening, then dispersed to various connecting flights. Claire's route took her through Atlanta before the final leg to Denver. She landed at Denver International at 11 a.m. on a Tuesday, 3 weeks and 2 days after she'd left. The airport was crowded with business travelers and families, all moving with the purposeful chaos of people who had places to be. Nobody looked at her twice, just another person in uniform passing through. She took a shuttle to long-term parking, found her car exactly where she'd left it, and drove toward the city through afternoon traffic. The mountains were visible in the distance, snow-capped and indifferent. Denver looked the same as always, clean, prosperous, comfortable in ways that felt almost obscene after where she'd been. Her apartment was stale and dusty but intact. She dropped her duffel bag, opened windows to air the place out, and stood in the center of the living room wondering what to do next. Unpack seemed obvious but pointless. She'd be spending most of her time at the hospital anyway. Her phone buzzed. Text from Dr. Sarah. Heard you landed. Take a few days to settle in. Your start date is Monday. Looking forward to working with you properly this time. Yes, Claire replied with a simple thumbs up and set the phone aside. 3 days to decompress, to transition from combat operations to civilian healthcare, to figure out how to be someone who didn't carry a rifle to work. She spent the first day sleeping and doing laundry. The second day, she drove to a sporting goods store and bought running shoes, then spent 2 hours on the trails near her apartment, pushing her body until her lungs burned and her legs shook. Physical exhaustion was easier than the other kind. The third day, she went to see David Ruiz. His sister had sent Claire her contact information through the hospital's patient relations department. Claire called and arranged to meet them at a coffee shop in Aurora. David showed up with his sister Rosa, both of them looking nervous. David walked with a slight limp, residual effects from the spinal trauma, but he was walking. That alone was a victory. Lieutenant Bennett, Rosa said, standing when Claire entered. Thank you for meeting us. I know you're probably busy. I'm not. Claire sat down across from them. How are you doing, David? He smiled, though it was shaky around the edges. Better than I should be, they tell me. The doctor said if you'd waited even another minute to put that chest tube in, I would have coded. They said what you did was... He trailed off, struggling. They said it was incredible. It was necessary. Claire kept her voice gentle. How's your recovery going? Physical therapy 3 times a week. Some nerve damage in my right leg, but they think it'll improve. I can work again in a few months. He met her eyes. I'm alive because of you. Because you didn't wait for permission or protocol or whatever the hell that other doctor wanted. Dr. Holloway, Rosa said, her voice hard. We heard he's been suspended, under investigation. Claire nodded. The hospital takes patient safety seriously. They should have taken it seriously before someone almost died. Rosa's hands tightened around her coffee cup. I filed a formal complaint. So did 3 other families whose relatives were treated by him. Apparently there's a pattern of him ignoring nurses' input and making dangerous calls. Good, Claire said simply. He shouldn't be practicing if he can't handle being wrong. They talked for another 20 minutes. David told her about his construction job, his plans to go back to school for engineering. Rosa talked about their family, their mother who'd been terrified when she got the call about David's fall. Normal conversation. Normal people dealing with the aftermath of something that had almost destroyed them. Before Claire left, David pulled an envelope from his jacket. I wanted to give you this. It's not much, but he held it out. Claire opened it. Inside was a card signed by David's entire family and a photo of him standing outside the hospital on the day he was discharged, smiling despite the wheelchair and the braces. I'm going to be at my niece's quinceañera next month, he said quietly. I'm going to walk my sister down the aisle when she gets married next year. I'm going to meet my nephew when he's born in December. All of that happens because you refused to let me die. Claire felt something crack in her chest, not breaking exactly, but shifting, making room for something she hadn't allowed herself to feel in a long time. Thank you for this, she said, holding up the photo. And thank you for fighting. Recovery is harder than the injury sometimes. You'd know, David said. She left the coffee shop and sat in her car for 10 minutes, staring at the photo. This was why she'd come back, not for recognition or authority or even justice. For this, the knowledge that specific people were alive and walking and planning futures because she'd been exactly where she needed to be. It was enough. It had to be. Monday morning arrived cold and clear. Claire, dressed in scrubs and a white coat, pinned her name badge to her chest and drove to Northvale Medical Center. The building looked different somehow, less imposing, more familiar. She parked in the staff lot and walked through the front entrance, bypassing the ER for now. Dr. Sarah met her in the administrative wing. She looked tired but pleased. Claire, welcome back, officially this time. She shook Claire's hand. I've set up your office, 3rd floor, and I've scheduled a department meeting for this afternoon so you can introduce yourself properly. I've already introduced myself. They just didn't care. They will now. Dr. Sarah's voice was firm. Things are different. Holloway's suspension sent a message. Administration is taking nursing input more seriously, and having you as senior trauma coordinator means nurses have someone in leadership who actually understands what happens at bedside. They walked to the 3rd floor. Claire's office was small but functional. Desk, computer, file cabinets, a window overlooking the parking lot. Her credentials were already on the wall, including her military commendations. Someone had done their homework. The Bronze Star came through official channels last week, Dr. Sarah said, noticing where Claire was looking. Administration wanted to make sure everyone knew who you are, what you've done. I'd rather they knew me for what I'm going to do here. Fair enough. That starts this afternoon. The department meeting convened at 2 p.m. in the ER conference room. 30 nurses, 5 physicians, and a handful of administrators packed into a space designed for 20. Claire stood at the front, feeling more exposed than she had running across that Afghan courtyard with an AT-4. Dr. Sarah did the introduction. Everyone, this is Lieutenant Claire Bennett, our new senior trauma coordinator. Most of you know her from her previous work here. What you may not know is that she's a decorated combat veteran with 4 tours supporting special operations units. She has more trauma experience than anyone in this room, and her role here is to ensure we're implementing best practices for critical care. Claire stepped forward. I'm not here to make you feel inadequate. I'm here to make sure patients don't die because we're too proud or too slow to do what needs to be done. A few uncomfortable shifts in the room. One of the physicians, Dr. Marcus Garrett, who Claire vaguely remembered as being less terrible than Holloway, raised his hand. How is this going to work practically? You're a nurse, but you'll be overseeing physician decisions in trauma cases? No. I'll be implementing protocols that physicians will follow. There's a difference. Claire kept her voice level. If you see a patient with obvious tension pneumothorax, the protocol will be immediate needle decompression followed by chest tube placement. You won't have the option to wait for imaging if the patient is crashing. If you disagree with the protocol in a specific case, you can document your reasoning and we'll review it later. But in the moment, you follow the protocol. And if we refuse, then you get reported to the medical director and the state board, same as any other protocol violation. Claire met his eyes. I'm not asking for anything revolutionary. I'm asking you to do what actually saves lives instead of what covers your ass. Silence. Then Amanda Torres, the young nurse who'd called Claire after David's surgery, spoke up. I think this is overdue. I've seen too many cases where we knew what the patient needed but couldn't get doctors to listen until it was almost too late. A few other nurses murmured agreement. The physicians looked less enthusiastic, but nobody outright objected. Progress, Claire supposed. The meeting continued for another hour. Claire outlined the new protocols, sepsis bundles, trauma algorithms, mass casualty procedures. Some of it was standard. Some of it came directly from her combat experience. All of it was designed to reduce the time between recognizing a problem and solving it. When the meeting ended, several nurses stayed behind to ask questions. Amanda was one of them. "Is it true you destroyed an enemy helicopter?" she asked. "Who told you that?" "It's in the newspaper. There was an article about local veterans. You were mentioned." Claire made a mental note to stop reading the news. "I was part of a team. We completed our mission." "Still cool," Amanda smiled. "I'm glad you're back, and I'm glad you'll have the authority to actually change things this time." Over the next 2 weeks, Claire implemented her protocols with methodical precision. She ran training sessions for nurses, reviewed trauma cases with physicians, and sat in on every critical code to observe how the team functioned under pressure. She wasn't universally loved. Some doctors resented taking direction from a nurse, regardless of her credentials. But she was effective. And effectiveness, Claire had learned, mattered more than popularity. 3 weeks into her new role, the ER got a call about a mass casualty incident. Bus accident on I-25, multiple critical injuries, all incoming at once. Claire activated the disaster protocol she'd designed, coordinating resources, assigning roles, preparing the trauma bays. The casualties arrived in waves. 15 patients, ranging from minor injuries to life-threatening trauma. The ER transformed into controlled chaos. Exactly the kind of situation where Claire's training became invaluable. She moved between bays, making rapid assessments, calling decisions, keeping everyone focused. One patient went into cardiac arrest. She ran the code personally, directing compressions, managing medications, bringing him back after 4 minutes of CPR. Another patient had a severed femoral artery. She directed the surgical resident through the repair, talking him through each step while maintaining pressure on the vessel. By the time the last patient was stabilized and sent to the OR, 3 hours had passed. The ER staff was exhausted but alive with the particular energy that came from surviving something difficult together. Dr. Garrett found Claire at the nurses' station, where she was finishing documentation. "That was impressive," he said. "The coordination, the protocols. It worked exactly like you said it would." That's what protocols do when they're designed for reality instead of paperwork. "I owe you an apology. When you came back, I thought you were going to be another administrator pushing policies that sounded good but didn't work in practice." "I was wrong." Claire looked at him. "Apology accepted. Just remember this the next time you're tempted to ignore a nurse because you assume you know better." He nodded and walked away. Amanda appeared a moment later, holding 2 cups of coffee. "Thought you could use this." She handed one to Claire. "That was amazing to watch. You were like a conductor, except instead of music, it was organized chaos." "That's one way to describe emergency medicine." "How did you stay so calm? Everyone was panicking, and you just didn't." Claire sipped the coffee. It was terrible, but she drank it anyway. "When you've worked in places where people are actively trying to kill you, a bus accident seems manageable by comparison. I want to be like that someday. That confident. Confidence comes from competence, and competence comes from doing the work when it's hard." Claire met her eyes. "You did good work today, Amanda. You anticipated needs, you communicated clearly, and you didn't freeze when things got complicated. That's what matters." Amanda smiled, genuinely pleased. "Thanks, Lieutenant. Claire, we're colleagues now." "Claire, then." That evening, Claire sat in her office finishing paperwork when Dr. Sarah knocked on the door. "Got a minute?" "Sure." Dr. Sarah sat down across from her. "I wanted to update you on Holloway. The State Medical Board completed their review. He's been placed on probation for 2 years. He can still practice, but only under direct supervision, and he's required to complete additional training on teamwork and communication in healthcare settings. So he keeps his license. For now. Any further incidents, and he's done permanently." Dr. Sarah folded her hands. "It's not perfect justice, but it's accountability, which is more than he had before." Claire thought about Stiles, who'd died before anyone could clear his name, about Reese, who'd betrayed everyone and would never face trial, about all the imperfect endings she'd witnessed where justice was approximate at best. "It'll have to be enough," she said. "There's something else." Dr. Sarah pulled out a folder. "Hospital administration wants to expand your role. They're impressed with the protocols you've implemented and the outcomes we're seeing. They want you to develop a system-wide trauma program across all 6 of our affiliated hospitals. Claire took the folder, opened it. Inside was a formal job description and a salary that was significantly higher than what she was currently making. This is a promotion. It's recognition and an opportunity to scale what you're doing here. You'd have authority over trauma protocols across the entire network. You'd train coordinators at each hospital. You'd set standards that could save hundreds of lives a year instead of dozens. Claire read through the description. It was everything she'd wanted: real authority, the chance to create lasting change, influence that extended beyond a single ER. It was also administrative, which meant less time at bedside, less direct patient contact, more meetings and politics. Can I think about it? Take a week. But Claire, Dr. Sarah's voice softened, you've proven yourself 10 times over. You've earned the right to lead at this level. Don't sell yourself short because you think you need to stay in the trenches. After Dr. Sarah left, Claire sat alone in her office, looking at the folder. The promotion made sense, the impact would be significant, and some part of her wanted the validation of moving up, of being recognized as an expert worth listening to. But another part was a part that had run toward gunfire with an AT-4, that had performed surgery in a storage room while explosions shook the walls. That part resisted anything that moved her further from the actual work. She pulled out her phone and scrolled through her contacts until she found Vickers' number. He'd given it to her before she left, told her to call if she ever needed anything. She hesitated, then dialed. He answered on the 3rd ring. Bennett, how's civilian life? Complicated. You got a minute? For you, sure. She explained the situation. The promotion, the expanded role, the question of whether to take it. Vickers was quiet for a moment. Then, what do you want to do? I don't know. The smart choice is to take the promotion. More impact, more authority, better pay. But I didn't come back to sit in meetings. I came back to keep people alive. You can do both. Can I? Because every hour I spend on administrative work is an hour I'm not at bedside. Every protocol I write for someone else to implement is another step removed from the actual work. Vickers exhaled. You want my honest opinion? That's why I called. Take the promotion. Build the system. Train the people who will be at bedside when you can't be. His voice was serious. You're one person, Claire. You can save dozens of lives with your hands. Or you can save hundreds by making sure everyone else knows what you know. Scale matters. It feels like giving up. It's not giving up. It's recognizing that your value isn't just what you can do personally. It's what you can teach others to do. He paused. You didn't stay a line medic in the field. You became a senior trauma specialist because someone recognized that your expertise was too valuable to limit to single operations. This is the same thing. Claire looked at the folder again. What if I'm not good at it? The administrative part, the politics. Then you'll learn. Same way you learned everything else. His voice warmed slightly. Besides, I've seen you run operations under impossible conditions. If you can coordinate trauma care during a firefight, you can handle hospital administrators. She smiled despite herself. Fair point. One more thing. You remember what you said to me before you got on that helicopter? When I asked if you were okay. I said no, but I would be. Right. And are you? Okay. Claire thought about it. About the nightmares that still woke her sometimes. About the way she tensed at loud noises. About how civilian life still felt vaguely unreal, like she was acting in a play about someone else's normal existence. Getting there, she said honestly. Good. Keep moving forward. That's all any of us can do. They talked for a few more minutes before hanging up. Claire set the phone down and read through the job description one more time. Then she pulled out a piece of paper and started making notes. If she was going to build a system-wide trauma program, she'd do it right. Evidence-based protocols, regular training, performance metrics that actually mattered, and most importantly, pathways for nursing input to be heard before patients started dying. She worked until midnight, building the framework for something that could outlast her. Then she went home and slept better than she had in weeks. The next morning, she told Dr. Sarah she'd accept the promotion. Within a month, she was traveling between hospitals, implementing protocols, training staff, transforming how the entire network approached critical care. It was exhausting and frustrating and deeply satisfying in ways she hadn't anticipated. 6 months after she started, the network's trauma mortality rate dropped by 18%. Preventable complications fell by 22%. Patient satisfaction scores increased. More importantly, nurses reported feeling heard, physicians reported better team communication, and the kind of near miss that had almost killed David Ruiz became increasingly rare. Claire presented the results at a regional healthcare conference, standing in front of 200 medical professionals and explaining exactly how they'd achieved those outcomes. When she finished, the applause was genuine. Several hospital systems reached out afterward, asking if she'd consult on their trauma programs. She was becoming exactly what she'd never thought she'd be. An expert others turned to, a leader whose opinion mattered, someone who changed systems instead of just surviving within them. It was terrifying and exhilarating in equal measure. One afternoon, Claire returned to Northvale's ER for a protocol review and found Amanda running a code. A patient had come in with chest pain, deteriorated rapidly, and now Amanda was directing the team, calling for medications, managing compressions, staying calm, while everyone around her panicked. Claire watched from the doorway, not interfering. Amanda ran the code exactly as she'd been trained, following protocols, making smart decisions, bringing the patient back from the edge. When it was over and the patient was stable, Amanda spotted Claire. "How long were you standing there?" "Long enough. You did well." "I was terrified." "I know, but you didn't let it stop you. That's what matters." Amanda wiped sweat from her forehead. "I keep thinking about what you said, that confidence comes from competence. I'm starting to believe it." "Good, because you're going to be running codes for a long time. Might as well get comfortable being uncomfortable." They walked to the break room together. Inside, several nurses were discussing a difficult case from earlier in the shift. When Claire entered, they made space for her at the table, asking her opinion on the treatment approach. She offered thoughts, asked questions, treated them like the professionals they were. This was the change she'd wanted. Not dramatic, not flashy, just the quiet transformation of a workplace where expertise was recognized regardless of whose name was on it. A year and a half after returning from deployment, Claire was invited to speak at a medical conference in Chicago about trauma systems and interdisciplinary leadership. She almost declined. Public speaking wasn't her strength. But Dr. Sarah convinced her it was important. The conference was massive. Thousands of doctors, nurses, administrators, all gathered to discuss the future of emergency medicine. Claire's presentation was scheduled for the main auditorium, 300 seats, cameras recording for virtual attendees. She stood backstage, watching the previous speaker finish, and felt the familiar spike of pre-action adrenaline. This was different from combat, but shared the same fundamental truth. She was about to put herself in a vulnerable position where failure was possible and consequences were real. Her name was called. She walked onto the stage, stood at the podium, and looked out at the audience. Hundreds of faces, all waiting to hear what she had to say. She took a breath and began. "My name is Claire Bennett. I'm a nurse, a combat veteran, and a senior trauma director. 2 years ago, I was working in an emergency department where my input was routinely ignored, where doctors talked over me, dismissed my assessments, and treated nursing expertise as background noise. I was invisible until the moment someone was dying, and I refused to let protocol matter more than their life." The audience was silent, attentive. "I'm here to tell you that invisibility isn't accidental. It's a feature of systems that value hierarchy over competence, and those systems kill people." She spent the next 45 minutes laying out the case study of Northvale's transformation, the protocols they'd implemented, the cultural changes they'd fought for, the measurable improvements in patient outcomes. She showed data, shared specific cases, and most importantly, she talked about the human cost of systems that didn't listen. David Ruiz almost died because a physician couldn't accept input from a nurse. Captain Stiles died thinking he'd failed his soldiers when really he'd been failed by a command structure that couldn't see past its own priorities. These aren't isolated incidents. They're symptoms of a deeper problem. We've built systems where being right matters less than being credentialed. She paused, letting that sink in. Changing this isn't easy. It requires physicians to accept that they don't have a monopoly on expertise. It requires administrators to value outcomes over optics. It requires nurses to speak up even when they know they might be ignored. But it's possible. I've seen it happen. I've made it happen. The presentation ended with concrete recommendations, protocol frameworks, communication strategies, metrics for measuring success, practical tools that any hospital could implement. When she finished, the applause was sustained. Questions came from all corners, doctors wanting to know how to handle resistant staff, nurses asking about building confidence to challenge physicians, administrators seeking advice on culture change. Claire answered them all, drawing on experience both military and civilian, offering honesty instead of platitudes. After the session ended, dozens of people approached her. Some wanted consultation services. Others just wanted to shake her hand and say they'd experienced similar frustrations in their own hospitals. One older physician, had to be in his 70s, waited until everyone else had left. "I practiced emergency medicine for 40 years, he said quietly, and I spent most of it thinking I knew better than everyone around me. I probably killed people because of it. I wish someone had challenged me the way you challenged that system." "It's not too late," Claire said. "You can still advocate for change wherever you are." "I'm retired now, but I'll talk to people I know who aren't." He shook her hand. "Thank you for having the courage to speak up. Some of us needed to hear it." Claire flew back to Denver that evening, emotionally exhausted but satisfied. The conference had been another milestone, proof that her expertise was valued beyond just Northvale, that the changes she was pushing for resonated with people across the industry. But the real validation came a week later, when she received a letter from David Ruiz. He'd finished his engineering degree, had gotten a job with a construction firm, this time as a project manager instead of a laborer, was engaged to his girlfriend. His sister was pregnant with her second child. "I'm writing this from the life you gave me," the letter said. "Every morning I wake up and get another day because you refuse to accept that following protocol was more important than keeping me alive. I can never repay that, but I can promise I'll never take it for granted. Thank you, Lieutenant Bennett, for everything." Claire kept the letter in her desk drawer, pulling it out whenever she felt overwhelmed or questioned whether any of this mattered. Because it did matter. Not in abstract ways measured by statistics and mortality rates, though those mattered too, but in specific individual lives that continued because someone had been exactly where they needed to be. 2 years after returning from deployment, Claire sat in her office at Northvale, reviewing quarterly outcomes data. The trauma program she'd built was now operating across all 6 network hospitals. Mortality rates were down across the board. Preventable complications had dropped by 30%. And most importantly, nurses across the system reported feeling heard, valued, and empowered to speak up when they saw problems. Dr. Sarah knocked and entered without waiting. "Got a minute?" "Always." "Board meeting just finished. They approved funding for the statewide trauma training center you proposed. Full budget, 3-year commitment. You'll be directing it." Claire looked up from her computer. "They actually approved it?" "Unanimously. Your outcomes speak for themselves. And apparently half the board saw your presentation from the Chicago conference. You made an impression." The training center was Claire's next big project, a facility where emergency personnel from across Colorado could come for intensive trauma education, combat-proven techniques, simulation training, the kind of preparation that turned hesitation into decisive action. "When do we start?" "Construction begins next month. You'll be operational in 18 months. Dr. Sarah smiled. "You've come a long way from the quiet nurse everyone ignored." "I was never quiet. People just weren't listening." "Fair point." Dr. Sarah stood to leave, then paused. "For what it's worth, I'm sorry it took a crisis for us to recognize what you could do. You deserved better than that. We all deserve better than systems that only value us when they're desperate." Claire's voice was gentle but firm. "That's why I'm building something different." After Dr. Sarah left, Claire stood at her window, looking out at Denver. The city spread before her, hospitals and clinics and emergency departments, where people worked under impossible conditions, doing their best with whatever tools and authority they had. Somewhere in that city, there was another Claire Bennett, another person with critical expertise being dismissed because they didn't fit the expected mold, another voice being ignored until it was almost too late. And maybe, just maybe, the systems Claire was building would mean that person didn't have to choose between being invisible and being insubordinate. Maybe they'd be heard the first time instead of the last. Her phone buzzed. Text from Hayes, who she'd stayed in touch with after deployment. "Just got accepted to physician assistant school, starting next fall. Thanks for believing I could do more than just follow orders. H." Claire smiled and replied, "You always could. Now you'll have the credentials to prove it. Proud of you." She set the phone down and returned to her work. There were protocols to refine, training modules to develop, a statewide center to plan. The work was endless, but it was also meaningful in ways that sustained her through the exhaustion and the frustration and the moments when progress felt glacial. Because every protocol she wrote was another David Ruiz who got to walk out of a hospital. Every nurse she trained was another voice that would speak up when it mattered. Every physician she convinced to listen was one less person dying because competence had been dismissed as insubordination. That evening, Claire drove to the trails near her apartment and ran until her body ached and her mind went quiet. The mountains loomed against the sunset, massive and ancient and utterly indifferent to human struggles. There was something comforting in that, the reminder that all of this, everything she was fighting for, was small against the scale of the world. But small didn't mean insignificant. She thought about the soldiers she'd kept alive in that Afghan compound, about Stiles, who tried to do right within a system that punished initiative, about Holloway, whose incompetence had been enabled until someone finally forced accountability, about all the invisible people doing critical work while being systematically undervalued. They deserved systems that recognized expertise regardless of credentials, that prioritized outcomes over hierarchy, that understood the difference between following protocol and doing what needed to be done. Building those systems wouldn't happen overnight, wouldn't happen perfectly, but it would happen piece by piece, protocol by protocol, one changed mind at a time. Claire finished her run as darkness settled over the city. Lights were coming on across Denver, hospitals where nurses were starting night shifts, emergency departments preparing for whatever the evening brought, training centers where the next generation of healthcare workers were learning their craft. And somewhere in that network of lights, someone was being heard who might have been dismissed before. Someone was making a decision that would save a life. Someone was refusing to be invisible. That was the legacy worth building, not monuments or accolades or even the recognition she'd finally achieved. Just the quiet transformation of systems that had valued the wrong things for far too long. Claire walked back to her apartment, showered, and made dinner. Normal routines, normal life. Except she'd never been good at normal, and she was done pretending otherwise. She pulled out her laptop and started drafting the curriculum for the Trauma Training Center. Combat-proven techniques. Evidence-based protocols. Leadership training that emphasized listening over commanding. Everything she'd learned from years of keeping people alive in situations designed to kill them. The work stretched into the night. Claire didn't notice the hours passing. She was building something that would outlast her, that would change how people were trained and valued and heard. It was the most important thing she'd ever done, even if nobody would ever thank her for it the way they thanked her for saving individual lives. Around midnight, she saved her work and closed the laptop. Tomorrow she'd refine it. Next week, she'd present it to the board. Next month, they'd start recruiting faculty. And in 18 months, the first class of students would walk through doors that wouldn't have existed without her. She thought about the young medic she'd been once, competent but invisible, dismissed because she didn't fit expectations, carrying skills nobody valued until people started dying. That version of herself would barely recognize who she'd become, would probably be intimidated by the authority, the responsibility, the weight of having influence over systems instead of just surviving within them. But she'd also be proud. Because this, all of it, had started with the decision to act when acting violated protocol. To save a life instead of following orders. To believe that competence mattered more than credentials. That decision had cost her one life and started another. Had taken her to war zones and brought her back changed. Had shown her that systems only stayed broken if nobody had the courage to fix them. Claire stood at her window one last time, looking out at the city she'd chosen to make her stand in. Denver wasn't home exactly. Might never be. But it was the place where she'd stopped being invisible, where she'd proven that quiet strength could be just as powerful as the loud kind, where she'd built something that would keep building itself long after she was gone. And that, more than medals or promotions or recognition, was what mattered. She closed the blinds and went to bed, knowing tomorrow would bring new challenges, new resistance, new opportunities to fight for systems that actually worked. The battles would never stop. The work would never be finished, but she'd never stop fighting. Because somewhere, right now, someone needed to be heard. Someone was being dismissed despite being right. Someone was choosing between invisibility and insubordination. And when that person finally spoke up, when they finally refused to be ignored, they'd find protocols that backed them up. systems that valued their expertise, and a network of support built by someone who'd walked that path before them. Claire Bennett had been invisible once, dismissed, overlooked, treated like furniture that occasionally talked back. She'd never be invisible again. And more importantly, she was making sure nobody else had to be either. That was legacy. That was justice. That was the quiet revolution that saved lives, one protocol, one conversation, one trained professional at a time. And it was enough.